Okay, all right, so I'm recording. This is the Community Board 11. So Ellie Rodriguez just texted me. Okay, I got you, Ellie. This is the February 2021 full board meeting of Community Board 11. It is February 24th to be exact. It is 7:03 p.m. I have a quorum, and I will turn it over to the Sergeant at Arms. A moment of silence.
Good evening, all, and let us please remember all the men and women overseas, our first responders, and also all the men and women that work in different areas that provide aid and comfort to the COVID patients and all other patients. Let's remember anybody that has had violence in their lives as well. Moment of silence, please. Thank you. Go ahead, Joe. Go ahead.
Okay, let me share the agenda for everybody, in case you don't have it. So we do have the 49th NYPD inspector from the on the meeting. So, Inspector, would you like to start? Say anything? I'll stop sharing the screen.
Can you mute me for some reason?
I'm going to mute everybody. Let me
Okay,
mute everyone.
Thank you, Chris.
Okay, unmute. Let me unmute.
There you go. Okay, Jeremy, can you hear me?
Yep.
Okay. First off, thanks for having us, Jeremy, and I want to say hello to the board and everyone on the call. As those of you who don't know me, I'm Deputy Inspector Nateev from the Commanding Officer of 49 Precinct. I've been here for a little over 2 years. I spoke with Jeremy earlier. He asked me not to get too detailed into crime stats for the 28-day period. So what I'm going, because I know you have a very lengthy agenda ahead of you, I don't want to add to that too much. But what I will get into is some of the more topical and newsworthy events that have occurred in the 4-9 over the last month. The first event that I want to talk about occurred back on February 19th. This did make the media. I think most of you may have seen it. In essence, basically, Tremont Avenue, older woman walking down Tremont Avenue when a male Hispanic comes up behind her and slashes her across the face for absolutely no reason. He then gets back in his car and takes off. This event happened on the 18th of February. 49 detectives in investigating the incident. They, this kind of looked a little strange at first. We conferred with some of our neighboring precincts, and what we learned is that a similar individual fitting a similar description had done the same thing in 2 other precincts, up in the North Bronx in the 5-0 precinct and in the 5-2 precinct. So detective squads from the 5-0, 5-2, and the 4-9 worked together. We were able to identify an individual, and on February 20th, we were able to apprehend him and place him under arrest. He was charged with all 3 instances. Further looking into this individual, it looks like he may be responsible for 2 additional random slashings up in Rockland County. The male that was placed under arrest, he's a male Hispanic, 21 years old. He does have a little bit of a psychiatric history, and he's currently in on $100,000 bail. So again, I think great work all around, and we grabbed a relatively dangerous guy in a short amount of time. The second incident that I'll talk about is it was a gas explosion which occurred over on 1520 Paulding Avenue, Friday, February 19th. For those of you who do not know, this was a 3-family brick home which had a gas leak in the basement. There was a spark that occurred. The gas leak to ignite, causing a rather large explosion. A total of 10 residents from 3 families were injured, 5 children and 5 adults. Of the 3 families, 1 were relocated by cross, and the other 2 families are staying with family members. Currently, the investigation is still open. It's being investigated by the fire marshals, but there's no criminality or foul play believed to be a part of this explosion. The last event that I'll talk about actually happened today. People may have seen of a lot of things going on around 4/9. A couple search warrants were executed simultaneously today. As a result of a long-term investigation by the New York State Police, along with Homeland Security and the Bronx District Attorney's Office, search warrants executed today. 9 of them were executed in the Bronx. Of the 9 in the Bronx, 7 were executed in the confines of the 4/9. 1 search warrant was executed in Queens and 1 in Westchester. In sum, without getting too much of the details, the New York State Police initiated a long-term investigation into illegal gambling at social clubs to get 11 search warrants for 11 different locations, and they executed them simultaneously today. There were no arrests made at this time, but it's anticipated that there will be more. There will be many arrests coming down in the future. Jeremy, I'll open up the floor for any comments, complaints, or questions.
Okay.
Yes, I have a
Hi,
question.
Bernadette. Bernadette?
Yes. So Inspector,
Yes.
good to see you. Good to see you. I have 2 quick questions, and I think you know what I'm going to ask. With the one that I always ask is with the this person who did the slashing, where, I know you can't give, I don't want to know an address, but what neighborhood did they reside? Did they reside somewhere in the confines of Van Nest?
He did not. He actually has a strong history to Florida.
Wow.
His primary residence is Florida, and he was just up visiting family in the Bronx.
Oh, Lord. Okay, my other question is, were any of the search warrants within the confines of Van Nest? The other search warrants that you...
On your end, no. I would say anything on the other side of White Plains Road. However, there were some in the vicinity, Morris Park.
Well, Van Nest goes up to Bronxdale Avenue. The neighborhood of Van Nest goes up to Bronxdale, so that...
So there was one on Bronxdale, 1667 Bronxdale.
Okay, and no others within Van Nest?
No.
All right, thank you.
You're welcome.
Hi, Deputy Inspector, this is Carlos Agreda. I have a question in reference to today. I was surprised to see that it was a search warrant for illegal gambling, yet it looked like a war zone, which did not merit, in my opinion, to have a war zone surrounding 4/9 area precinct. And one item was also on Mace Avenue near Eastchester Road, same similar type of club. Do you know why all that force was needed? I happened to be at a barber shop. At least 5 concussion bombs or whatever were thrown into that club on Laconia Avenue.
Frano, great question. And I don't want to cop out of this, but I'll try to give you some insight based upon my experience. Again, this was a investigation initiated by the New York State Police, not NYPD. I was not privy to this until actually the search warrants were conducted. But working in narcotics and doing tests, one of the key things we look into is the safety of the officers. When you're going into a location, no matter what kind of intel you have, you never know what's going on behind those doors. So yes, sometimes these other units, they go in with a little bit of show of force, but that's all to protect. And what that does also is the people on the other side of the door, it prevents them from getting rid of evidence or permanent evidence to a case. But what we did, once I was made aware of the search warrants that were executed, I sent out 4/9 personnel. I sent my community fair guys out to some of the locations and uniformed officers, so at least the community could see 4/9 cops out there, and they're approachable. If there were any questions, they could speak to the 4/9 cops. Not sure if I answered your question, but hopefully I gave you some insight.
Is there a way of getting a better answer from somewhere why all that force was used? I mean, literally, I thought I was in a war zone.
I can put you, if you send us your information, we'll see if we can get you in contact with a representative from the New York State Police. And I'm sure they have a community outreach where they'll give you some more insight.
Jeremy, can you do that, please?
We can follow up.
Okay, thank you, Detective. Inspector. I greatly appreciate. I appreciate Detective Stebevan sending that email as well. It was very useful.
Great.
Inspector, it's Edith Blitzer. I have a question. Hi, Jay.
Yes, Edith.
Okay, the young man that was found deceased at 2140 Kruger. Any more information on how he got in there?
The deceased individual. So again, this is a open homicide investigation.
Right.
What I can tell you is that the deceased and the individual responsible for the deceased being deceased
Mhm.
know each other. It's they're known to each other. Individual has been identified, and we're currently looking for him.
Okay,
so-
thank you.
You got it.
Inspector Ken Gelnick, we've heard about all of these officers being assigned to the transit. How many officers from the 49th precinct have been assigned, and have more been assigned from the 49th than from other precincts?
So here in the 4-9, what they did, as you may or may not know, there is a transit bureau in the NYPD, and their primary responsibility is, the transit system. So because of the increase in quality of life type crimes and or violent crimes in the transit system, a lot of the precincts, or they have a lot of the precincts, send cops to stations within their command. I have 2 officers on the day tour, 2 officers on the 4 to 12 that are assigned to subway platforms or subway stops within the confines of the 4-9. So although they're not being used in the 4-9, to address, community concerns, they are in the 4-9, but they're working in transit. And I believe citywide, it's 400 to 500 cops that they're deploying in this fashion.
But they have not been assigned to other precincts. They're still within the 4-9. They haven't been assigned to other places.
They're still looking at 4-9, yes.
Thank you, Inspector.
You're
Anybody else? If not, move on.
Jer, hold on. It's me, Chris.
Yeah, Chris.
Inspector, hi. Jay, thank you for the email. I just wanted to let know, especially Joe Thompson, since he's the chair of economic development. It happened that when we had the meeting, one of the places that was rated today is going to be up for renewal, liquor license renewal. I suggest that we should deny that. And that's the hunting club, Inspector.
Yes, I'm aware.
Okay. Thank you.
Jeremy, can I say to Jay, I don't receive no updates anymore.
You're on my list. I'll have to take a look, okay?
Leave it over email.
Oh, okay, thank you so much.
Okay. Thank you very much, Inspector.
All right, thank you, Jeremy. Take care, everyone. Have a good night.
Night.
So that means we move on to the chairman's report for D'Angelo.
Yes, all I have is just a reminder to everyone, letters will be going out to those people that have been remiss in coming to our meetings. As you can see, tonight is a perfect example how hard we have to wait until we get a quorum, and we were only over by 1 or 2. Again, if you're going to be on this board, you volunteer to be at our meetings. There's 10 meetings a year. I think we can make 7 or 8 of them at least. So those letters will be going out during the week, right, Jeremy? You're going to send them out this week?
I'm going to send them as soon as possible. I mean, some of them were supposed to go out earlier, but obviously there was a printing issue.
Okay, as soon as they get out, at least, we have to work together. If we're gonna be a community organization, then, we all have to pull together, especially in many cases, we have committee reports. A committee is trying to have a meeting, and there's a meeting of one. Person gives up their time, comes to a meeting, or, gets online for a meeting, and no one shows up. That's just, it's rude, and it's counterproductive. So if you want to be part of the board, I think, the least you can do is show up for our meetings. That's all I have, Jeremy. Okay.
Veronica still here?
Hi, I'm here. I didn't hear you, sir.
All right.
The treasurer's report has been given to the office, and it will be sent out to anyone. It'll be sent out to the board, and if anyone has any questions, just reach out to me.
I did send it out like around 6:50. That and all the minutes that I have so far for most, I think for all the committees I have minutes for. So I know, even if they already sent out previously. So is Hazel in yet? No, she's coming late, so we come back to her. So I did like last month, I did do the addendums, and the January report was pretty lengthy, but it has some, I'd say, important stuff in there. So if you have any questions, please talk to me offline or off the meeting. Text me, call me. Committee reports. Bylaws should probably go first. So unless, Yahe, you really need to go, I would defer to bylaws if that's okay. That's maybe a typo.
Yeah, I'm good with that.
Okay. David? David's still in the meeting? You love it?
Can you hear me now?
Perfect.
Okay. So the bylaws committee met this month, and I will address the issues that we talked about in a moment. But first, we need to take a vote on two items that were presented to the board last month. And I think, Jeremy, you're sharing the screen that shows those two motions. The first is to revise Article 4, Section 5 of the bylaws to allow the treasurer to serve as acting vice chair of the board without violating the existing rule prohibiting a board officer from holding two officer positions at the same time. The second motion is to revise Article 4, Section 2 and Article 5, Section 5 of our bylaws to allot only one vote to the treasurer when serving as acting vice chair of the board at meetings of the executive board and at meetings of the leadership committee. So these are really technical changes that involve the very short period of time that the treasurer, when serving as acting vice chair of the board, how they can vote. And so if there are there any questions? Is there any questions about these motions before we go to a vote? Okay, then these motions are on the floor, and we'll take separate votes on each one. Is there anybody who is opposed to the first motion to revise Article 4, Section 5 of the bylaws? I don't hear anybody who is opposed. Is anybody abstaining? I don't hear any abstentions, so we'll mark that as unanimous. The second item is to revise Article 4, Section 2 and Article 5, Section 5 of the bylaws, and I will ask if anybody is voting against. Is anybody abstaining? I don't hear anybody against or anybody abstaining, so we'll mark that down as unanimous as well. Moving on, Jeremy, can you scroll down a bit? Thank you. So I am not going to read all of these. I think it will just cause more confusion. I distributed the minutes a few days ago, and these recommended changes are not up for a vote this month. I will ask if anybody has any questions about any of the changes. If I read each of the changes, then we're going to be here for some time, and I think it'll just cause tremendous confusion. Does anybody have any questions about the proposed bylaw changes?
David, this is
Yes.
Bernadette. I don't have any questions about these, but before, I do have questions. I have two questions that I would like to add. So as soon as this is done, I would like to ask you before we go on to the next committee.
Okay, we can do that in a moment because these are being presented to the board per our bylaws. They're not being voted on this month. They will be voted on next month, and there'll be an opportunity to ask questions at that time as well. Plus, anybody can write to me or anybody on the bylaws committee if they have questions. So, Bernadette, what were your issues?
Okay, there were two things that I wanted to bring up to avoid any further confusion. There was, and maybe two things to bring up to the next committee for the bylaws committee. One thing that was actually I had talked about in 2015. I did not follow up on it. It was never brought to the committee, and I'd like to revisit that at the committee level and not take up the board's time here. And that is about having a moratorium of 5 years on naming of a building. Okay. I know that in the bylaws for the street naming, as I read them on the form, it says that there has to be 2 years before that, if I'm correct. Okay.
Well, Bernadette, your issue is well taken, but I'm not sure that it goes to the bylaws committee because the transportation committee, with regard to the street naming, they set that policy. And if there is, if you want to change the policy about naming a building, I don't know what committee that would go to, but that's up to Al. I don't know that it's really a bylaws change.
Okay, but it's something that had come up previously in previous years that Vaness was involved with. So I guess I'll bring it up, Al, with you, and we can find a place for it somewhere, but it has to be somewhere in our bylaws, you know, be part of our amendments because buildings do get named. So I don't know, I guess we can discuss that. I'll find that out. The other issue is about the street naming. The proposed street naming that was brought. David, I had asked you, sent you an email early this week and I didn't get a response, so I'm bringing it up. I wanted to just have more discussion on that, but I do want to make a statement to the board with regards to the street naming that was brought up, which is was brought up by Yahe. And I did want to apologize in one way because there was an error on my part. And the letter of support was really made from me personally, but was sent on the letterhead of Vaness Neighborhood Alliance. And that was an error and it was a misinterpretation. I was not able to bring that information to the board or to the Vaness Neighborhood Alliance in a meeting because right after Christmas, unfortunately, myself, along with my whole family, was tested positive for the coronavirus. And my older brother also, we almost lost him. He was on a ventilator. So besides being sick, etc., I did not bring that information to my board, and board did not have a meeting to discuss this and come to an agreement. So my letter states from me, but it was sent on the Vaness Neighborhood Alliance, and it gave an interpretation that it was from an okay from the Vaness Neighborhood Alliance, and I was in error, but there were circumstances, etc., that brought me back into catching up with my emails in mid-January, where we were in full swing with the proposed homeless shelter at 1682 Stillwell. So I was basically in error on that, and I want to put it on record. But for what everybody else, whatever their decisions are, I still stand by my support because I was on the board in 2008, and in 2009, we did have Mother Teresa Way brought up and street named for the Albanian group culture in our confines of Community Board 11. And for that, I should have checked. But I thought that since something like that had gone through, then naming an iconic hero for the Yemeni culture, which after reading, I did support the person and his fight for freedom. So I did support it. So there was a bit of a misinterpretation, which I do want to correct publicly, but I still do support. But I do want the bylaws, Community Boards 11 bylaws, a bit more specific. But I also am reading in the bylaws form, which is a little bit more specific. But I think it needs to be addressed because this is going to come up again. It needs to be clear whether somebody could be clearly accepted or clearly denied.
So David,
why don't we leave this to the Transportation Committee to work out the details, and when they hammer out the policy and then the board votes on it, we can fold it into the bylaws if that's what everybody wants.
I'm requesting that, and I would like to be there at the meeting when that happens.
I'm requesting that also, Joanne.
Okay, but as the chair of the bylaws committee, I think it'll only make it more complicated to bring bylaws into it right now, because then we'll have to have a joint meeting with bylaws and transportation. When transportation can meet and do these things, bring it to the board, approve it, and then we can put it into the bylaws. Let's not make it more complicated than it needs to be.
I agree. I just want to know the proper protocol to make something like that happen. So
that's my recommendation. Al, what do you think?
I agree, David. That's exactly the way we should handle it. Let the Transportation Committee come up with a proposal, and then we can have our say on it, and we can vote on it. And then
Frano wanted to say something. I don't know if he still does.
Sorry, yes, I do. We already initiated information requests which we obtained, and we did say that it will be addressed at our committee. So yes, it is our committee's responsibility, and I agree with David, transportation takes a crack at it before anybody else.
Correct. Yes.
Okay, so I think we're all in agreement.
Yes, David, thank you.
Yes, thank you. And I just really want to put this on record for my error, because I know that there was just some there was some information that did not get to the Van Ness community. So
thank you, Bernadette.
You're welcome.
Okay.
Thank you, David.
Before I close out my report, I just want to ask one more time if anybody has any questions about the bylaw amendments, and also invite anybody to reach out in the next month before we vote on these issues next month. So if there's no questions or comments, then I will close my report. Thank you.
Thank you. Community Development, Andrea Siegel. I did send your minutes out, just so you're aware.
Thank you. We had a well-advertised public hearing on Wednesday, February 10th. Fortunately, we had no participants. Following that, we had a committee meeting. The minutes have been submitted and will be uploaded eventually.
Okay. Economic Development, Joe Thompson.
Okay, Edith has the minutes and will address the board.
You tell Edith Shkreli she could not come tonight.
Okay, I picked the right person. Well, we did meet. We had 4 locations to look at. Now, because these are licensed premises, and most are closed, and most are going through transitions anyway. But the locations that we did look at and we did study, we had comments from all the board members, and the board members were familiar with some of the places. I was familiar with some of the places. Let's see, for instance, we had Kirby's restaurant, I'm sorry, Ruby's restaurant, and that was on, that's at 600 Van Nest Avenue. And we found nothing wrong there. We found no problem or problems at all there. We also checked with the office and we talked to Chris, because Chris keeps a record of any problems that a licensed premise does have. So even though we're familiar with it, we also have the board report. So Chris, if you want to jump in on any of this, please do. But we had no problems with that. The hunting club, that's at 2503 Williamsbridge Road. We were familiar with that location, and the committee had no problems with that, and the office had no problems with that. La Masa Corporation, that's at 1000 Morris Park Avenue, and I know people here are familiar with it.
Joe,
But,
Joe, let me chime in. Don't forget about the hunting club. We just heard from the police that there was a raid. So that one,
that was
I
different.
suggest we deny them the liquor license. Well,
Yeah, that's
we
true.
suggest to deny the liquor license. We can suggest only.
Yeah, it's a recommendation. We don't have the actual authority to do that. But
yes,
But I think
so
under the
everybody's aware.
circumstances.
Well, hold on, Joe. Joanne Rubino did do the minutes. She did send it to me. I just forgot about it. So I will get that out to everybody as soon as possible.
Okay. But I think under the circumstances and the fact that they were engaged in not just illegal activity, but also against the covert rules. And this is something that was pretty new and just came into us. But under the circumstances, when the police raid someplace, I don't think that we should approve it. So let's put that on the side. Well, let's take care of that right now. I'd like a motion that we disprove the hunting club, 2503 Williamsbridge Road. Someone second that?
I second
it.
Okay. Do I have any objections?
Joe, open
to
for
that
discussion
motion?
first, please.
Oh, yeah, we can have discussion. I forgot. Is there any discussion? Would anybody like to make a comment on this? And
Yeah,
maybe you're
I
more
started
familiar with the
very
hunting club than I
unpleased
am.
with the way, I am very unpleased with the way the action was taken. I think for a gambling joint to have a warlike status is disgusting. It's disgusting for the community, and it's unfair to the community. It made us look like we're in Lebanon or somewhere where we face war all over us.
Well, that's harsh, but we get the point, and it's true. It does reflect badly on our community to have this going on. This cannot be the first time it's happened, or else the police wouldn't have information in order to make the raids. And it's not just the local police, but it's also the state police.
Shouldn't they be innocent until proven guilty?
Well,
And
under the
also, the
circumstances,
49 precinct wasn't even aware of this. So something is not kosher.
we cannot approve it and have it go forward and hoping that they'll be found not guilty in 6 months or a year. We have to take some type of action now. As far as the community is concerned, this is a violation of our community. This is something that our community should not have.
Just a point of order, Joe, if you don't mind. You do not have to make a recommendation. It's entirely up to the board. One way or the other. You don't have to be in favor or against. It's really up to you, the board.
The only reason I'm I'm going to abstain anyway, but the only reason I'm mentioning it is because maybe it can be tabled until next month until you get more information or something. I just, because someone was raided doesn't mean they're guilty, whatever information they have. And if the 49th precinct was involved, then you might have some intel. But since right now we're just going off a raid, I just don't feel like it's fair to the establishment. And I'm just mentioning it not just because it's that type of establishment. Any establishment, I feel like it might not be fair to them. Regardless, like I said, I am abstaining, and I usually abstain in these votes.
Okay, well, I see your point here, and it's a very good point. But it wasn't just a raid, it was an arrest also.
Okay.
So this kind of changes it a little bit. But I'm willing to say, okay, let's give it until our next meeting, and let's table it. And
Joe,
next month.
let me intervene a little bit. You gotta understand that it has to be within 30 days. So I think the 30 days are already expired. So
yeah, we
have to do it promptly. So we have to be able to send it to SLA, because once the 30 days pass, then they can put it in. No matter what a recommendation we issue, maybe the SLA is going to issue already the SLA liquor
I thought there were
license.
no arrests made.
There were no arrests made?
I think that's what the captain, the inspector said. There were no arrests made.
No arrest, he says. No, he said no arrest.
Okay. But this took quite a bit of it.
Joe,
You have one?
I have a question.
So go ahead.
Suppose they do file for their permit and then they are found guilty or we get more evidence. Can we notify the State Liquor License Bureau to then revoke their license?
Well, the State Liquor License Bureau will revoke it anyway. They get more information than we do, and they get it fast. So I'm not too concerned about that. But I do know that when you're taking on an operation this large, where you have city, state, and finally the local precinct involved, that is problematic. I want to say they're guilty. I don't want to say they're not guilty, but the mere fact that they were raided after an investigation by at least two different separate agencies that work together on this. But I think under the circumstances, now, if we're gonna make an error here, then let's error it in this respect. If we deny it, they will go before the SLA anyway. And if the SLA finds that there's no grounds for it, then the SLA will give them the license. But I think at this point, and for us and for our community, that we should deny it.
Let's continue the vote. Call for a motion and we'll vote. Okay.
Okay, well, my motion is that we deny this application. And if I can get a second.
Can I just second it, Joe? Hold on, point of order, Joe.
You want
we don't have
discussion? We did.
Yeah, we don't, no, I just want, we cannot deny, we have no authority to deny a liquor license. So I think the motion should be recommend denial.
Oh, okay. Then our recommendation would be denial. And if I can get a second for that.
I second you, Joe.
Okay, now all those opposed.
Aye.
We have one opposed.
We need names. I need names.
I'm going to abstain. I don't know enough information about this.
No, we're going to call an abstention. But first, we want the no. So we have one person with a no vote. Who's that? Okay. So we no votes. Okay. Do we have any abstentions?
Joe Mentor, abstention.
Okay.
Joanne, total on abstentions.
I abstain.
Abstaining.
Fernand Segura abstaining.
Ken Gelnick abstains.
Edith Blitzer abstains.
Daisy
Rodriguez abstains.
Avril Francis abstain. Don't have enough.
Okay, so
This is
I count.
Hazel. This is Hazel. Hello.
Hazel.
Yeah, I have to abstain. I just came into the meeting, so I have no idea what you're talking about, so I have to abstain.
Okay.
Hey, Jeremy, do you want to do a roll call, the opposite?
Yeah. Yes,
I think we have.
So, I said was it you were abstaining anyway.
Yeah.
So let me mute everybody, and I need to mute everybody. Okay, Al, what are you doing?
I'll abstain.
Okay, I got a feeling it's going to be all abstention or mostly abstentions. I got Yahe, Veronica. I don't think I heard.
I agree.
Abstain?
I agree.
Are you
No.
in favor?
Yes.
Okay. So Hazel abstained, Frano abstained. I don't think we have Tasneem. Christian is not here tonight. Valerie Babb, I don't know about. Joseph Baycoat, I don't know if he joined yet. Edith Blitzer abstained. Darrell Bohan abstained. Junior Campbell's not here. Pat Charles, not here. She's excused. Paula, not here. Patty De Jesus, are you able to unmute yourself? *6 if you're calling in. Going all the time, Pat? Yeah.
Okay.
So how are you voting?
Abstain.
Okay, abstain. Bernadette,
Yes,
in favor?
in favor.
Okay. Averill?
I abstain, Jeremy.
Okay. Yeah, if you abstained earlier, I think you said earlier, I didn't get everybody, so I got you now. Rabbi, I don't know if he's in yet. And Galnick, I forgot, did you abstain?
Abstaining.
John Johnson, is he in? John Johnson? Going once? Twice? Deborah Kolick? She in? Debbie in?
I'm in favor.
You're in favor?
In favor.
Okay.
John Johnson is in. He can't unmute.
Okay. Let me, hold on. Is that him? I think that's him. Let me mute everyone and then unmute you, John. Hold on. I requested, go ahead. Hello? John? I can barely hear you.
He needs a new headset.
What's that?
Justin.
He's abstaining?
Can he vote in the chat?
He abstained, Jeremy.
I see it. All right. See it. Okay. Malini Lahose? Able to unmute? David Levitt?
I'm in favor of the motion.
Sylvia Mazzella? Natalie Medina? So, Ellie Rodriguez abstained. So,
In favor.
Natalie?
Yeah, Natalie, in favor.
Okay. John Menta abstained. Ann Norris?
Abstain.
Emily Pemberton?
Abstain.
Strato? Is that? Strato? Okay, is Strato in?
Yes, Jeremy.
So what are you doing?
For the motion, yes.
For the motion. Okay, Keith Ramsey, I don't know if he's in. Richard Reynoso?
Abstain.
Got Daisy abstained. Ellie Rodriguez abstained. Fran Rubino?
In favor.
Okay. Oral?
I'll have to abstain because I'm 100% sure.
Okay.
Yeah, so I'm abstaining now.
Good. Okay, thank you. If everybody can mute that's not talking. Andrea Stevens?
In favor.
Okay. Cecilia Smoker? Cecilia? Okay, if she can, we can come back to her, or Mulaney, I know she was in the meeting. Lisa Soto, is she in? Should be.
I'm here and I abstain.
Joe Thompson, in favor, I assume? I'll assume yes, until otherwise. What? Joe Chair Lounge?
Abstaining.
Sandra Unger?
I agree.
Favor, okay?
Yeah.
I don't know if Janice or Linda are in. Anybody else? I didn't catch you. Cecilia Smoker or Mulaney, and Joe Thompson I put is in favor. Let me go back and add them up. Bear with me. Should I assume Cecilia and Mulaney are no longer in the meeting? If so, let me know.
Yes, I'm here.
Who is that, Cecilia?
Yes, I just
You're in
got back in.
Okay, are you in favor or against the motion?
I'm in favor.
Okay. You're back in. That's 11 votes in favor. Do you want the total? But there are more abstentions than there were votes. So I got to count it up exactly, but it's definitely it's pretty overwhelming. Just bear with me.
Jeremy, what is the recommendation?
Motion fails. There's no question about that. It's just by how much. So if everybody wants to wait while I count up the abstention.
19.
Yeah, I mean, it's at least here. We can come back to exactly what it is.
So we recommend SLA what?
No, there's no recommendation. Really.
Okay.
So, Joe Thompson, it's still your plate.
Jeremy.
What's that? No, you're muted. It seems like muted.
No, unmute yourself because we're not hearing him.
I can't unmute him. I can only mute him. Should be the bottom left, Joe, of the screen.
Okay, can you hear me?
Yes.
Okay, well, we all know that an abstention is a no vote. So the motion was to deny. And since that motion was denied, that means that the motion to recommend approval is passed. So
No,
this
no, no.
will go.
Joe, that's not correct, Joe. Basically, the motion is not to recommend. It's a no recommendation. It's not a denial or an approval. It's no
For
recommendation.
the recommendation? Oh, okay. So we stand neutral on this as a board?
Unless somebody wants to make a motion in favor of.
It's a motion for no recommendation.
And
Yeah, I don't think a motion would pass to make a recommendation in favor at this point.
So make a motion that there's no recommendation there. Get a second for that? Motion is for no recommendation,
Right.
pass or fail. So we have a second?
Joe, it's my understanding you don't need to make another motion. Basically, if the original motion failed, we don't need to recommend. We just send it as is that the community does not want to approve it. That's all, or disapprove it.
We don't even have to do that, Fran. We don't have to send anything. We just move on.
So we don't do it then.
So
okay.
I recommend that, and I that's a good idea, Frano. So Joe, is there anything else that you need to report?
Yeah, we do have a couple more.
Joe, it's
yeah.
Joanne.
Hi, Joe.
I have the minutes before me that I had sent out.
Oh,
I
great.
don't know, I sent it out on Google Docs. I don't know if everyone received it, but we have Rainbow Diner, Pasta, Caridad and Louis, as well as La Masa. So I just wanted to,
Oh, good. Thank
tell you
you.
that.
Thank you, Joe.
Yeah.
Well, let's go with Rainbow first. And Rainbow Diner, of course, has been here longer than I've been here, and they've been here in excess of 30 years. It's owned by a gentleman. He's always opened it. He's always run it. It's a 24-hour spot. He works it during the day. His son works it overnight. It's open 7 days a week. Never had any problems with Rainbow. It's a well-known establishment. There is no alcohol. Well, there is beer, but that's about it. So we have no complaints about Rainbow Diner at all. So the motion is that we approve Rainbow Diner. I have a second.
Joe, when we had the meeting, we were going to put them all in one motion, except for, of course,
right.
Hunting Club now.
Correct, Joe. That's what we said.
Yeah. We're gonna put that in one meeting, so let's hold that unless there's a problem with that. Masa, that's 1000 Park Avenue, and Morris Park Avenue. La Masa is well known in the Morris Park community, and we had absolutely no problems with La Masa. Ruby's with it. Now, on East Gun Hill Road, we have 3 Jack Restaurant Corporation, which is Caridad and Louis Restaurant. The restaurant itself has been there for many, many years. Caridad and Louis just opened a couple of years ago. I've been in there personally. It's a well-run establishment. It's mostly food. Plenty of entrances and exits. I personally had no problems with it. The committee had no problems with it either. So unless there's a problem, I'll lump that together with the rest. And what did we have also?
Pasta, Joe.
Pasta.
Yeah, pasta. I think everybody is familiar with Pasta Pasta. And that's been there for many, many years. And we have even had affairs there, events there from the community board. We had absolutely no problem with Pasta Pasta. The office has no complaints about Pasta Pasta, so we had no problems with that at all. Joe, do we have anything else?
Yes, we have La Masa and we have Ruby's.
Okay.
Already, we did all
Really,
those
we
already.
did that.
Yeah, you mentioned them all. Let's just
Let's
call for
vote,
a
Joe.
vote.
Let's call for a vote.
And
Yeah.
also, let me add something in, as Joe mentioned, we consulted with 49 Precinct. 49 Precinct hasn't had any problems. You gotta understand also that for almost 1 year, all these restaurants have been closed. And with exception with the club, I don't know, club probably was open or something like that. So, and all of them has been suffering when it comes to about, issues financially. So we should take that also under consideration. That's what I have to have.
Correct. Thank you, Chris.
Okay, so lumped together, I see no problems with anything. Our committee found no problems with anything. There was always at least one member of our committee who was very familiar with these locations. So based on that, I make a motion that we have no reservations about any of these locations. Do I have a second?
I second.
Okay. And do we have a discussion? Then we'll all in favor. Let's have an aye or.
Aye.
Let's just say who's against. But that's I just muted everybody. You too, Joe. Sorry, but it's everybody. So the best way is just who's against and abstentions if it's overwhelmingly. Yes. So sorry, Joe, you're still muted. Sorry.
I'm abstaining.
Okay.
Go ahead.
So,
Go.
do we have any abstentions? We've got one. Yeah. Hey, do we have any other abstentions on this? Okay. So based on that, the locations should go with our recommendation that we have no objections to them. And the place that we do have a problem with was our first location. And I'm pretty sure we're gonna get some follow-up on that. And if we get some follow-up on this location, by the time our next meeting rolls around, then I'll make sure that everyone knows exactly what the police have put together. Okay? All right.
Sounds perfect, Joe.
I think
Thank you, Joe.
that's the end of our report.
Thank you, Joe. Nice job.
Thank you. All right, we have one elected official in. I was told we should turn it over to them. I don't know if anyone else is in. Any elected officials, not the reps, but the elected officials themselves. So,
Vanessa Gibson is on.
yes, that's who I'm referring to.
Oh,
First
okay,
and
sorry.
foremost. It's okay. So, Ms. Gibson, you want to unmute yourself? And we're now just to clarify, we voted recently. The leadership committee. We're giving you 5 minutes initial speaking time. You and every other elected, and then we try to limit it to 4 questions or comments thereafter you can respond to without a time limit. And we just so everyone's aware, we may be having Senator Biagian and Assemblymember Fernandez, but 5 minutes also applies to them. 5 minutes uninterrupted speaking time. Frano, who's our Sergeant at Arms, will be timing everybody. So that's all yours.
Okay, great. Thank you so much. Thank you. Good evening, everyone, to our district manager, to our board chair, all of the executive members of Community Board 11. It's great to be with you tonight. I hope and pray that each and every one of you are healthy, well, and safe, and your families are doing good during this challenging time. I bring you greetings from the West Bronx. Councilmember Vanessa Gibson of District 16, and I'm grateful for each and every one of you at Community Board 11. To all of the elected officials and staff, members of the public, and each and every one of you, thank you so much for allowing me to be present at your monthly general board meeting. Just a couple of updates I wanted to provide for all of you on behalf of the New York City Council. I am proud to now serve as the new chair of the Committee on Oversight and Investigations. This is the committee that was formerly led by former council member, now Congress member, Richie Torres. This is a new committee started by Speaker Johnson that works closely with the Department of Investigations. We look at all investigations of agencies. We look at accountability and transparency, and we are holding a hearing in the next several weeks related to an issue that we've been working on around homeless services contracts. So be on the lookout for that. I am also the co-chair of the City Council Women's Caucus. There are 13 women in the City Council, and we work closely on issues affecting women, young ladies, girls, and families. We've been dealing very closely with issues around pay parity, gender equity, women's health care, and maternal health care. And so I look forward to our work this year on behalf of all women across New York City. I am also a member of the Budget and Negotiating Team and the Bronx City Council delegation. So that is important as we begin the budget process for the next fiscal year, FY22, which begins on July 1st. We start with our preliminary budget that's been presented by Mayor de Blasio, and we are starting hearings at the City Council virtually, of course, on Tuesday, March 2nd. We begin with the Office of Management and OMB. Every agency will come before the City Council during the month of March to talk about the priorities of that agency. We are very hopeful that we will get federal support this year. Last year's budget was very painful. We had a $9 billion deficit. This year, $5.5 billion, and we are adamant about restoring a lot of cuts that were made to agencies, expanding UPK and 3K, making sure we have a comprehensive summer youth program better than last year, and doing as much as we possibly can. I am working currently on 2 pieces of legislation that is very important to all of you. Small businesses, many of them have struggled to survive. Many of them are on the brink of closing. They're struggling with paying taxes, with keeping their doors open, and really providing a service because of a reduction in customer service. We are working with Chair Mark Jonai, Chair of Small Business, and we're introducing legislation tomorrow, as stated, that will relate to a reduction fine program. We want to work with all small businesses and develop a plan to reduce many of the fines that businesses have been subjected to by a number of agencies, not just sanitation, DCP, a number of other agencies, as well as working with ECB, the Environmental Control Board. We want to provide some sort of relief as best we can for many of our struggling businesses. So we will be introducing that bill tomorrow. Just this week, the mayor announced a Food Forward NYC plan, which is an ambitious initiative that focuses on developing a 10-year food policy strategy to deal with food justice, food equity, and food waste in New York City. All of you have seen the long lines at food pantries and soup kitchens. All of you have been out serving food and PPE. We have many residents that are more in need now than ever before. Food is a basic necessity, and we need to have universal access to healthy food all across the board. So that is what we're working on. We're working with the Mayor's Office of Food Policy, and I'm so glad that our legislation passed to mandate a 10-year food strategy. And yesterday's announcement by the mayor, Food Forward NYC, is a plan that we will work with. All of you have seen a number of COVID-19 testing sites up and running throughout the borough. Now that we have the vaccine, we have a number of sites at Helcom Hospitals, North Central, Jacoby, and others. We are proud to represent Yankee Stadium, where we have the largest vaccination site for Bronx residents, but we know that's not enough. So we're working with all of our legislators, with Governor Cuomo, on expanding sites so that we can offer convenient transit areas where we can have sites in large areas that are convenient so all of you can get the vaccine. We're also working on expanding the coverage, the eligibility, first responders, essential workers, restaurant workers, taxi drivers, everyone that interacts with the public, older residents with underlying health conditions. We want to make sure that we have enough. And so the last thing I'll say, budget priorities for all of you. If you have anything, please let me know. Thank you so much. Thank you.
Any questions? Right.
Yes. Hi, Ms. Gibson. I'm Naomi Pemberton. How are you? I have a two-part question. The first one is I'm glad, congratulations on leading the investigation committee. But I wanted to know, will you be incorporating anything about equity when you are approaching this position? And two, I wanted to bring up that I have a personal issue. I was trying to set up my mother for vaccines, and I'm sure other people are having this issue. And it took me 4 hours to do so. And that was searching all over the internet, trying to find a place, trying to, coordinate times and care. And my issue is that's not fair to an elderly person or anyone in our community. So I just wanted to know if you had any action plans or thoughts on what you guys are going to be doing about making sure that our elderly, anyone in the community is able to easily access a vaccine.
Great question. Thank you, Naomi. So the first thing I'll say about vaccinations, when we rolled these vaccine sites out, it was in partnership with the governor, the mayor, Department of Health. The Yankee Stadium site is operated by Somos Healthcare and the National Guard. There's a 1-833 Somos NY number, as well as a website, somosvaccinations.com. And it is appointment only for Bronx residents only. But we understand many residents do not have internet access. They don't have connectivity to even get on the internet, and many of them struggle with just the phone calls and confirming appointments. Now, we did have a shortage across the country because of the federal government, and some of the appointments had to be delayed and canceled. There was a lot of hitches as we rolled this out. We are better now, and the vaccine, we're getting the supply here. So some of the sites are a little delayed in getting the actual vaccine. That is happening across the board. But you should never have to take 4 hours to confirm an appointment. Elected officials are working with many of our partners like Bronx Rising, Morris Heights Health Center, Urban Health, VIP. All of these sites are doing vaccines at their own locations, but we're also doing appointments ourselves. If you call our office,
Hold on.
we can help you so that you don't have to deal with the...
Excuse me, council member, I muted everybody because somebody was doing something in the background. So if you just unmute yourself, you should be fine.
Okay, sorry. Our office, Naomi, is actively helping with appointments. We work directly with Bronx Rising, Morris Heights Health Center, VIP, Health and Hospitals, any of the entities that are currently administering the vaccine. We've been working directly with them so we can get people set up. You should never wait 4 hours for any appointment. That's unacceptable, and that should not happen. So if you are encountering that, please reach out to us, elected officials. We will help you, the community board as well. We have to make sure as we expand sites, they are equitable in distribution and location, convenience, transportation. We are working at the council because we realize a lot of our residents are homebound and medically frail. They can't get out of their apartments. So we need a mechanism and a plan from the city and the state that provides the vaccine at people's doors. We need to provide some mobility, working with folks on the ground, the FQHCs or any of the healthcare partners. And so we have legislation in the council that seeks to expedite this, right? So hopefully we'll get that bill passed in the next few weeks because we want to make sure there's a way to get to everybody. And as you know, these are vulnerable residents that need the vaccine the most. So if you're encountering that issue, please reach out. We will help. As far as equity and oversight and investigations, absolutely. We look at every agency and the work they're doing, the contracts they're administering, and we've seen a lot of deficiencies, a lot. So we are working, we're having hearings this year as the budget process begins, because we have to make sure that everyone is doing their job, they're working efficient, contracts are or have oversight, they are analyzed before they're approved. We're talking about millions and millions of dollars of taxpayer money that is disseminated to providers, whether it's homeless services, social services, housing, education, whatever it is, coming from an agency. So our oversight capacity will be just that, working with DOI. We also have oversight over the background investigations for all city workers. We've serious backlog, thousands of people languish in the system. So we've been able to drastically reduce the number of outstanding applications and get people up and running to become a part of the municipal workforce. So be on the lookout. We'll make sure you get emails. Everything is being done remotely, sadly, but the City Council's website, you can get emails on upcoming hearings as well as checking out the City Council's calendar.
Hi, good evening, Councilwoman Gibson.
Thank you.
Good evening, Councilwoman Gibson. My name is Darrell Bowahan.
Good evening.
I have a quick question. What is the city going to do regarding marketing to market the vaccine in such a way to get people to take it? Because remember, a lot of people in the Bronx are skeptical. So we have a skeptical borough right now. So we need people to be on board, and I think the marketing is very important. What do you have plans into designing something to get people intrigued?
I agree with you and I share your concerns. And we've been working with the Department of Health and Health and Hospitals on having an education and outreach campaign. A lot of the events we normally would do are no longer in person. So elected officials, community boards, we've all been hosting virtual informationals and webinars. I had one last week with health officials, and we're talking to residents because we understand in not just the Bronx, but in communities of color, immigrant communities, you have this resistancy to the vaccine. There is a deep-rooted history in many of our communities where people have been very worried about side effects and just the experimentation itself, right? There's a long history, and we have not forgotten that history. So I think it's important when you have medical professionals that are talking to residents in a language they can understand, in a way that they can certainly relate to. I've been sharing with residents that come to us about their concerns. Do you have a primary care doctor? Talk to your PCP. Make sure they answer your questions. Talk to a medical professional. We refer them because we're not doctors, we're not medical professionals, but we know that a lot of people are very worried. We know that science, we can trust and we can listen to our medical professionals, but there is this hesitancy in the Bronx. And we saw that when we rolled out Yankee Stadium. So I believe the city has to embark on a robust campaign. We should be seeing, PSAs and campaigns in multiple languages, because we really have to go to, number one, the communities hardest hit. Number two, the Bronx, which has the highest death rates of COVID, right? No question.
Right.
We need to do all the work we can. And we have to work with folks on the ground, like all of you. I don't expect the Department of Health to come to my district, but I expect them to call me and call my tenant leaders and say, hey, we have brochures, we have pamphlets, this is information we want to get out, social media, emails. Like, we need to start doing a very robust campaign. So I would love all of your help and certainly your suggestions as we move forward, because as you know, everything that we try to do has a price tag, and we need to be able to make sure we pay for it. So that may be a budget item that will come up this year.
And I believe it's the strongest budget item, because right now I'm skeptical, and the only reason why is because certain parts of the borough, we see people still maskless, chin in the air, walking around. They don't even believe in a mask. So, the problem with that is, and that's my concern, because the vaccine, if we can't even get control of people wearing masks, how can we get a lot of our borough residents to wear, to get a vaccine? That's my biggest concern. That's why I was talking about marketing. And, something put in the budget to really, really, put it out there.
Okay.
Good
Can I just jump onto Darrell?
No, hold on. I have Chairman D'Angelo reach out to me before you, Naomi. Sorry.
Okay.
Go ahead.
No problem.
Councilwoman, you're working with the oversight committee and with the homeless,
Yes.
with the homeless shelters. Now, we have a problem on Stillwell Avenue. We have a homeless shelter going up on Stillwell Avenue, where the city is paying an exorbitant amount of money, a lot more than the property is worth. It seems that we're making millionaires on the backs of the homeless people, and that's a disgrace. If you look into that, you will see that the property was paid, the amount of money paid for the property was almost $1 million more than the asking price. And they're renting it for, I think it was $3.25 million a year. Is the rent. That's disgraceful. And that's something that people should start looking into. It seems that there's certain people that work with the city government that are making a fortune on the backs of the homeless, and that's disgraceful. So I would just ask if you'd please look into that for us.
Okay. No
Thank
problem.
you.
Thank you.
Thank you.
Yeah, and also, the same
well, hold
thing,
on.
going back to what he's saying is that on 1682 Still Avenue, right? There's an issue with how the applicant for the permit, right? Typically, you have to file for a new building if you're going to build a new structure there or something, right? But he filed for an alt. So how is that possible? Can you look into the filing process of this person trying to file for the homeless shelter? I'm an architect, so I kind of know what's going on. So can you figure out what that process is, because it doesn't seem as if he's approaching this in the right way.
Okay.
Thank you, Vanessa.
You said 1682, right?
1682 Stillwell Avenue, yes.
Got it.
And then after Naomi, we have Yahe. Go ahead, Naomi.
I'm sorry, I had a problem unmuting. No, I just want to quickly say that to Councilwoman Gibson is that in France they are doing a mobile unit, and in Israel they have, I think they're up to 50%. So why are we not looking at what's working globally to bring it here back to New York?
I agree, we should, and there's nothing that precludes us from doing so. I think the challenge has always been, how do you get the vaccine to the city? How do you provide the mechanism on distribution that is equitable? And then let's be honest, how do you navigate the state and city? Senator Biaggi is on the call, and I know she will address this as well. But I think we have to look at what other places are doing and doing it successfully. 500,000 Americans lost their battle to COVID. That is a real number. Family members, friends, neighbors. It is so painful to think about 500,000 people, and many of them I knew right here in the Bronx. It is not acceptable. And I think we have to do any and everything possible to get the vaccine out, to allay concerns, to make sure that there is access and opportunity, because the deaths of our brothers and sisters should not be in vain. If we learn anything from this global pandemic, we are reminded of disparities, deficiencies, and just so many things that have gone wrong in this country and this city and our borough. We have got to do better for the sake of those that we lost. So I appreciate that. And I know Senator Biaggi and others will chime in.
Yahe?
Yes, hi, Ms. Gibson. Thank you for joining us. So the city and the state, they were in a hurry to shut things down, businesses, barbershops, houses of worship, based on zip code. Now, when we need vaccines, how come it's not based on zip codes? Because I've spent 4 days on that website that you mentioned, Somo's website, the health department, the New York State Health Department, over a week there, actually a couple of weeks. I called that 1-833 number. No one ever picks up. They want you to leave a voicemail. So why can't we halt the vaccines to, like, for example, to the Upper East Side and bring it to the zip codes that we have here? I mean, it was such quick action, executive order after executive order, shut down houses of worship in 10467. Well, 10467 is one of those, hot spots. So how about we get, like Ms. Pemberton said, a mobile site to get those people vaccinated? It doesn't seem, I know you're saying equitable. Equitable maybe doesn't fit in the scenario when it comes to vaccines. It shouldn't be all zip codes are equal, because they weren't equal when the shutdown happened. So that's my request to you. Thank you.
That is true. I appreciate that. And certainly I want to work with our state elected officials, because all of the eligibility requirements has all come from the governor's office. First responders, essential workers, and we have been getting a lot of concern about other essential workers that have not been eligible. And we've had to put in requests to the governor and get approval. We had to fight to get taxi workers, restaurant workers approved, and then people were complaining because they felt that they were jumping ahead. I mean, it's not been an easy time. It's been very challenging. So I want all of you to know that just as you are frustrated, so are the elected officials. And now that we have 1A and 1B category, potentially now 1C, we have to make sure that there's a better process, because it's frustrating to have to write letters and send emails to the governor's office and get approval for people that are right in New York City, that have been out in the front lines providing services and keeping people safe, and they're not protected. As one example, HPD inspectors that come out and inspect apartments, they're not eligible for the vaccine. Not acceptable.
So, Ms. Gibson?
Yes.
So one board member, this is Jeremy, the district manager. So one board member reached out to me and asked me to ask this question for you, or for them. Sorry. Since you're on the committee for investigations, we proposed a savings of at least $1 million a year to the city with our alternate sites. And the response we got from the city, some of people that we know that know this process very, very well, for lack of a better word, thought the response was not a real response. So if you can look into that, particularly, I can share with your office the letters we sent to elected officials, in addition to the mayor and Commissioner Banks.
Okay, great. Thank you. If you could send that, I would appreciate that. We are always
Yeah,
looking at
this
ways
has
to
been an
save
ongoing
money.
problem with that 1682 Sewell Avenue. You really have to find out what's going on with that, because it's a problem right now, and to me, it really needs to be addressed. And otherwise, it's going to be an issue. And for most people in that neighborhood. So just the whole process of them going after this property, we have to look into that further, please.
Okay. Thank you. Thank you, everyone.
Thank you.
Unless there's anything else, thank you very much, council member. We will now turn it over. I saw in the order that I saw them appear. That's okay. Assembly member Fernandez.
Good evening, everyone. Good to see everyone. I missed last month's meeting, so Happy New Year if I haven't seen you. But also Happy Black History Month, Happy Dominican Independence Day and Independence Month. Happy Purim and Happy Lent, or I wish you a peaceful Lent for the next 40 days. But just, I guess, a run through, I am aware of a lot of the concerns that have been presented here and prior to this meeting. The Stillwell Ave shelter, I agree that the location is a concern, and I support the community's position in finding a different location because we know that there is a need in this area, in this district, and at best we can be good partners to find that. So Councilwoman Gibson, I look forward to seeing what you can find out about why a new location is not something they want to talk about. But regarding the vaccines, this is something I too have been pushing with the governor's office. As soon as they announced that the vaccines were available, I gave a list to the governor and the mayor of various locations, including our catering halls. I think looking at Maestro Caterers, Eastwood Manor, these are ideal locations that have the space, that have the parking, that have the temperature controls, all that. But a concern was if, and this is, talking with Maestros, will you pay my electricity bill? Because if I'm going to have the facility open, running all these things, we need to make sure that we're supporting our small businesses. So that has been a holdup as far as getting a new location. But myself and members of the delegation are fighting to get another vaccine site, especially here in the North Bronx. It's a good thing that we have it in Yankee Stadium, but it's still too far for a lot of our residents here, especially seniors. But through advocacy, we were able to get a round of vaccines to the senior NYCHA buildings that we have here in the 80th Boston Road Plaza did get their vaccines, and the push is needed. My logic for it, why are you not focusing on this area? I understand that the numbers fluctuate, but if we continue to ignore this area, the numbers will just then be the majority here. So I look forward to seeing what we can get done with that. And forgive me, I just want my notes in front of me. I heard about a dog park that is being axed of for Loretto Park. I personally think that's an adorable addition and I personally support it. But if there's still room to keep bocce ball, I think that's a little historic addition that we should keep within Loretto Park. My office did get a request for a speed bump installation around St. Clair. So we have reached out to DOT and they're conducting a study. We followed up with an abandoned house. I think it's at 5757 Van Nest Avenue. That was in line to get demolished, but of course COVID had left everything up in the air, and they're looking into it again to see when that schedule will be on track, because an abandoned house just invites a lot of unnecessary things here. I will be doing COVID testing out of my office. I know vaccines are a priority and we definitely want that. And yes, I agree, the hotlines that are available at Jacoby, it's very hard to get an appointment through. And my office has been helpful in trying to expedite these requests for anybody that does reach out. And I want to apologize if nobody phones. My office is working remotely, and every day the calls go to one of the staffers' cell phones. And if the staffer is on their phone and another call comes in through the assembly line, then it gives the impression of a busy signal or disconnected. So if it's possible, please try to make sure you follow up with an email if you can. And if you know of a neighbor that has called and has not been able to get through, I just encourage you to please send the message this way. We do reach out to every call, email request that we're getting, because we want to make sure that you are still being heard and, you know, concerns are being heard. What else? So in 2 weeks that the vaccine sites will be available. I mean, COVID testing will be available in my office, I believe 2 days a week. So that schedule will be put out as it's available. One thing that I believe everybody is aware of here, the East Bronx is getting e-scooters. This is something that overall in the East Bronx area, I think would be a helpful addition, because it is a transit desert. There aren't many bus lines going that way towards Throsneck.
20
Obviously, no
seconds.
subway lines. Oh, 20 seconds, jeez. Okay.
Yeah, sorry, 5 minutes.
Albany, we did pass some legislation in the next couple of weeks, and the Assembly is moving to pass a package of bills regarding the nursing home debacle that it is. We really do need to get some reforms in order. I'm supportive of an investigation to make sure that we find out exactly what happened there. But other items that we passed regarding help to small businesses, there is that available up to $5,000. So for a business that has built an outside structure, you can get help being reimbursed at time. Okay, so any questions? I'm open.
Is it,
Natalia Fernandez, can you send
is
your
it test?
email in the?
Hold on, one at a time. April, go ahead.
Yes. Can you put your email in the chat box?
Absolutely.
Okay. And then if you're done, April.
Thank you,
Oral?
Jeremy. Thank you.
Oral?
Yeah, quick question. The test that you're doing, is it going to be a rapid test or the regular testing that takes about 3 or 4 days to get through to the results?
I believe it's rapid testing. So I will confirm that, but I remember the staff speaking, saying that it would be rapid testing.
Yeah, and do you have any news on the new Johnson & Johnson vaccine that's coming out? Is it, you know, how available will it be in the Bronx?
I have not heard any updates on that. It is the 1-dose version as opposed to Moderna
Right.
and Pfizer that is 2 doses.
Right.
And the last update that I heard was that it's about 65% effective.
Efficacy?
So yes.
Efficacy. I heard it. I saw 86%, okay, that's what I heard. I heard it was
Okay.
86. And,
Well, that could have been an
65.
update. Again, I can double check and send information to board members. But I haven't heard a date as to when that one will be available yet. And
Okay,
then
thank
to come off of one of the last questions to Councilmember Gibson about, you know, getting the word out there and trying to encourage members of the community to get the vaccine. Myself and I believe Senator Biaggi and Councilman Jonai helped support a grant that Bronx House is receiving to give instructions and informationals about the vaccine in various languages, because we understand that that is one of the separations and the gaps in getting everybody in the community to be comfortable with the vaccine. We got to talk to them in their language to make sure they understand everything about the vaccine. I did do a forum on my Facebook Live, I think about 2 weeks ago. So if you do check my page, you'll see a 1-hour discussion with doctors from North Central Bronx Hospital and Acacia Network, debunking all the myths that there are about the vaccine. But I encourage everyone, and I could take it from this room, but you know, as much as everything else, talk about it, educate your neighbors to make sure that we get everyone vaccinated.
Thank you, Natalia. That was me, Darrell, who asked that earlier. Appreciate you approaching that.
No problem.
I have a question for Natalia.
Yes.
It's Bernadette. With regards to the 757 Van Est, that house had a huge fire, and my friend lived there. It's terrible, but I was in that house for quite a few years growing up, and so I'm glad that I just hope that could get done. But I know that you only have half of Van Est. Now I'm going to ask Assemblymember Reyes to speak to you with regards to how, for the process of doing that for two other locations in Van Ness, which is 588 Van Ness and also 1641 Garfield Street. These are not owned by the banks, which has been the problems, but they are unstable in their structure. And there has been squatters in 1641. There's been problems in both of those areas, and they have been around for, I'd say, over 10 years. So if there's any way that you could team up with Assemblymember Reyes or look into it, Van Ness would be greatly, greatly appreciative.
Absolutely.
And any other questions you have, you can, give me a call.
Will do. What was
Thank
the
you.
Garfield address?
588 Van Ness and 1641 Garfield Street.
Okay.
They're right around the corner from each other.
Gotcha. Okay. I will definitely look
Thank
at
you.
it.
I have a question, Jer.
Yeah, go ahead.
Hey, Nat, it's Andrea. How are you?
Good. How are you?
Good, sweetheart. About the vaccine. In this Pelham Parkway area, I think, like you said, Bronx House getting out literature is well and good. However, there's a lot of people in this neighborhood who want the vaccine who don't know how to go about getting it. And I think somebody's suggestion about having a mobile unit to do it, I think that is one of the most brilliant ideas I've heard. Get like a school bus or something, with nurses on it, and just tell people, come here and you can do it.
I agree. I think as much as flu shots happen in park towns and everywhere else. I'm sorry, did everybody hear me? I was loud.
Yeah, there's feedback from Andrew's line.
Okay.
Just go ahead.
No, I agree. As we get more vaccinations, we need to make every effort to be right in the community, in everyone's backyard, with information and with the vaccine available. So my dream is to have it, yes, the mobile unit driving around giving vaccines everywhere. But that is something that is being worked on, especially with the numbers that we are receiving. And hopefully when we do get the millions of vaccines available, we can just be everywhere, getting it out.
As far as I mean, everybody I know who wanted it so far has been able to get it. But unfortunately, there's a lot of my neighbors do not have internet, do not have computers, are not tech savvy to even know about how to go about getting it.
Well, the office is, we're working remote, but
Andrew, you have to mute your phone.
we are remote, but as same, I'm getting requests for masks and things like that. We will come in to get the items from the office to, give it out. So if you want to direct anybody my way, if you can email their information, we can call them and make a day that they could come to the office and help them get registered online. Or if we can do it over the phone, we can help make those appointments. But every which way that we can help with the tools in the office, with our knowledge in the process, we're open to doing.
All right, Edith Blitzer had a question. Edith, I saw you were able to unmute yourself. You could try that again.
Left.
Bottom left of your screen. It's there when you move when you move towards it, you should appear. Actually, I'm not sure what type of device she's on. Yes, cell phone.
I think I saw Edith left.
No, she's still in here. I requested she unmute. Did do it briefly. It might be a cell phone device, which is usually what, 3 dots up in the upper right hand corner, I think, something like that. So in the meantime, I mean, I can't there she goes. Edith, can you talk?
Natalia, good to see you.
Hi, Edith.
I remember when Mark was able to get us a DOT van, a bus van, right on the corner of Key Food and Lydic Avenue, in order for people to get on and get their Metro cards. Why can't we have a van like that to educate the people in our area? There are a lot of people, like Andrea says, that cannot get on the computer. I have a problem myself. But if we have a van right outside with multiple language people speaking, I'm sure we can get a lot of people that do want the vaccine and don't know how about to get it.
Well, you're right, and I actually brought that question up to Montefiore Hospital, and asking if they can provide a mobile COVID test. We're in the time of the budget right now, so people are trying to figure out what they can afford to do and what we have the resources for. But that is something that I asked Montefiore to explore. If you can't give out, COVID tests or the vaccines in a mobile way, then please, come out in the community and help educate us. So
Well, that's
I
the thing. Education is the key word here to a lot of things. And this is so important because, like Oral said, and the other guy said, people don't want to wear masks, never mind taking the vaccine because they're so unsure and they're frightened. And I understand it, but we need people out there talking to them, telling them it's for your sake, it's not dangerous, but we need to educate the people.
Well, I mean, I agree. As much as I'm out there giving out masks, encouraging, you get the no thank you, I don't believe in it, then you can try. And unfortunately, you can't get everybody to believe what you are sharing. But again, we must keep trying. We must keep pushing the information out there. We're hoping to get everybody on board with the solutions that we have. And the solutions to this pandemic are wearing a mask to protect yourselves and others and getting the vaccine. So I will look into that to see about getting some sort of mobile unit, whether it's from North Central Bronx, Jacoby, or Montefiore. But
Makes no
agree.
difference from who, as long as we get it.
Exactly.
Maybe they can give us a bus.
Well,
Wouldn't
yeah.
hurt them.
Actually, there is a what's the one on the corner of Bronxdale and Anton Place? UCHC. They have a mobile unit. So let me look into that one and see if that can come around.
Thank you, I appreciate it.
Yeah, the main thing is that we cannot discourage our residents. That's what the problem. If you're going on a computer, you can't get anything. You don't know what's going on or how to get access. You're discouraging people. And I know myself. I was going to give up yesterday after 4 hours. So we have to figure out a way to get our people encouraged to go and wear a mask, one, and get their vaccine. So this is what our issues are.
So Al D'Angelo had a question.
Yes, hi, Natalia. How are you?
Hi.
We get mixed messages from our politicians. We have one guy saying, "Don't wear a mask. You don't have to wear a mask," and you have our governor turning around and telling people, "Don't take the vaccine." I wouldn't trust the vaccine when it first came out. So I think Oral said it. I think we need publicity as far as that goes to let people know it's safe. It's okay to take. What ramifications may be? You may get a sore arm. You may get a little bit of a fever one day or whatever. And so they're not afraid of getting the vaccine. The second thing is I teamed with Jacoby Hospital, and as a community leader, not as a chairman of the community board, but I've been reaching out to all the community leaders, telling them, if you want the vaccine, send me a name, date of birth, and your phone number. I took a list. I sent a list to Jacoby. Jacoby called every one of them. They've been perfect. They go in, they get their shot, no wait. People don't have to fool around with the computer. So I would just suggest that maybe our elected officials, somebody from each of your offices, collect that information, work out a deal with Jacoby. You call in, you'll send them, email them the names. They will go out and call. They've been perfect. I can't thank them enough for what they've done for the community. I mean, Pastor Gooden has sent me people, Yahya has sent me people. I've gotten people from all over our area, but not too many people know me, so they don't know to send it. If they don't hear it from word of mouth, that I can get this done. But if we reach out to one of the hospitals, Jacoby's been great, but Montefiore should be doing the same thing. So if our elected officials could reach out to them, get the list of names, phone numbers, and date of births, and let them call up and set up the appointment. This way, you become the middleman. They don't have to get on a computer. They don't have to worry about waiting an hour or 2 hours on the phone trying to get through. It's done all through email or text. And the other thing is, Mark Joe and I called him and I said, look, I have elderly people in their 80s, well into their 80s, and they're not mobile. So he worked out a deal with all I have to do is call him up, tell him what time and what the location is, and he sends an ambulette to pick them up and bring them to the site at Jacoby. So, again, if we team up with the hospitals like that, we can get everybody, inoculated that wishes to be inoculated. But again, I think Oral said it, the publicity, we have to take away the negative publicity and let people know it's safe to take this vaccine.
Absolutely. And as community leaders in this room, I thank you for being on that message. And I just feel it is a matter of helping each other get the message out. So I don't got to explain to here, but everybody is, if you have something, share it, push the positivity about it, the truth about it. And that is a good idea. We have done that to an extent for those that were comfortable sharing their information with us, helping them get appointments at Jacoby and North Central Bronx.
Jeremy, can I say something, please?
Yeah, bro.
Al, you're going to always have negativity. You're going to always have the positive and you're going to have the negative. It's not something that I think that anyone can control, even if you put the flyers, you put it in the media, it's all over the media. The positive is how many people are dying every day. That is the word. And you're going to always find people who don't believe in the mask, because there was a time they say wear your mask, now they say wear 2 masks. People wasn't wearing 1, now you're telling them to wear 2. So you can always have that. But I think the word is out. I've seen so many Zoom meetings from Vanessa Gibson to all Natalia, all the officials. Everyone is doing their own thing to spread the word. And when I came on, Jeremy, the first person that was on, and she was explaining, was it Edith? No, that she got the shot and she really
Harriet, probably.
Yeah, it was Harriet and myself, and I think Edith. We were talking about the shot. She explained how she felt, and she really impressed me and encouraged me. So, the word of mouth, the different positive words you get from people, the word is getting around. It's out there. Every day you see Cuomo, every day you see the mayor, you see the governor, it's out there. The people are getting the information. But what you can do, Al, can you please send your information in the inbox so that we can know how we can contact you for those who in need and can get it at Jacoby. And I'll do my part with that, but we need your information because this is the first time I'm hearing about what you're doing.
Let me tell you something about Jacoby. They are fantastic. I got my first shot there 3 weeks ago. The nurses, the staff, they are fabulous. I just really want to thank them openly. I go for my second shot on Saturday because unfortunately they ran out of vaccine last week. But if you go to Jacoby, you will get the royal treatment from anybody that's there giving you the shot. I've been knocking at the doors of my building, showing them my arm that there's nothing there and that I'm fine and I'm talking and I'm still bitching. And quite a few people have been going there to get their vaccines because now they're not afraid. It's word of mouth, showing them that you're still alive and you're fine.
Yeah, so if you get your vaccine and you're on social media, I mean, it gives me that little bit of encouragement to see, look, I got mine, 1 dose down, on to the next one. And to just show that, it's not something scarce, it's not unnormal. This is what we have to do to beat this virus.
That's right.
Oh, unless there's anybody else, we do have an elected in here. So I don't think anybody else reached out to me. So Senator Paggi, we are, unfortunately, we are timing everybody. I'm sorry, Natalia, if we didn't give you the message in time. We're timing all electeds for 5 minutes, initial speaking time. Thereafter, questions are a free for all.
Free for all.
Thank you, guys.
How do we measure free for all, Jeremy? I'm just.
It should be limited to 4, but
I'm just being facetious. I'm just kidding. Okay, thank you, Jeremy. I appreciate it. And yes, I heard the 5-minute rule. Okay, so I will try not to repeat anything that anybody has already said, because a lot of information was said. But I think I do want to start just from the top by just saying good evening, everyone. Nice to see you here. I think the most important thing on our minds is vaccines, right? So from the level that we've all heard, I want to add a few things in. The first thing is that in the 11 months leading up to a vaccine being rolled out, the state did not put in place a protocol. That is why it is so chaotic. And that is the reality of what we are dealing with every single day. Okay, so that's number 1. Number 2, the executive branch of our government has not been transparent with the legislature, even though the Department of Health Commissioner has come to visit the legislature several times. A lot of the questions that we have asked as members, as leadership, have not been answered or have taken months to answer. And it is very hard for all of us, and I know I'm not speaking alone here, to do our jobs when we don't have information. Why? Because the number of people who call my office every day are calling because they're afraid and want to get a vaccine, right? They're also afraid of the vaccine, to what we've heard here as well. So there has been a really bad rollout. And so I just want to apologize for that, because it's not acceptable and it should not be happening in the state of New York. I heard somebody say, shouldn't we be looking at other countries and other places? I will let you into some information that I know. The country of Israel actually reached out to the legislature, to certain members of the legislature, to offer their help to New York. And when members of the legislature shared that information with the governor's office, there was no response. Since then, they may have been in touch, but this was just 2 weeks ago. So I just want you to know that it's not as if there isn't a lack of understanding of what other places are doing, or to the point that was made as well, the mobile vaccine sites in upstate New York in the Mohawk Valley, something that has been working, which is a new creation, is literally a vaccine on wheels, essentially. And so the way that it's been happening is the provider of the vaccines has an MOU with the hospital, and they just provide it. So it's something I've also proposed to the state, especially in the Bronx, because in my opinion, I heard the argument about zip codes. Like, there is no place in the state that needs vaccines more than the Bronx. The Bronx has literally been the epicenter of this COVID-19 vaccine. So that has been the message upwards, and I want you to know that. In terms of what we are doing, every single Friday, we're making sure not only to capture people who call and are wanting vaccines, but we're also making appointments for them. So if you know somebody who needs an appointment, I'm sure all offices are doing this, but again, we're all doing all the things. And so if you find that you have a dead end somewhere, you can call us, or you can call us first. Pick your adventure. It doesn't matter who you call, just call us, and we're not helping you out. I think Hazel is on here. I cannot see her just because there's so many pages of people, but Hazel, Emily will be calling you about vaccines for the set of people that you had sent to her. And I just found this out just only a few hours ago, so that we can help with some of the seniors that are on your list. In addition to that, every Friday we do a lot of wellness checks for seniors, because they are the ones who not only don't want to leave their homes, as you all know, but they're also the ones who need help getting to and from where the vaccines are. Okay, that is that. I have a lot of other things to talk about, but let me just say what we've done this week, because I think it's relevant to the topic at hand. The nursing home death count in New York, I'm sure that you know, I'm sure you've heard a lot about this, has led to some positive outcomes, which are the passage of legislation in the Senate. So I'm going to share with you what that has been, because there are ways to make our laws for nursing homes stronger. And so here are a few of the things that we did this past week, okay? So just from the top, we did a patient care ratio reporting, which essentially means that there has to be a plan where it says that 70% of the revenue from nursing homes has to go to direct patient care, which is, I think, a very smart percentage ratio to do, because a lot of the percentages are not that way, and especially for profit-driven nursing homes. Okay, publications of nursing home ratings. What does that mean? Okay, nursing homes will get ratings, so you'll know if that nursing home has an A or an F. Thinking about long-term care and creating a task force for that, allowing compassionate caregivers to visit. We know that a lot of what has really caused mental health decline in our seniors is because people have not been able to visit their loved ones in nursing homes. And so that's something that we've done. Inspection audits, requirements for transferring and discharging and voluntary discharge, so that there actually are just communication happening to families, and then standards for ownership of nursing homes, making sure that the department has records, and other things that we will put into the chat. Okay, thank you.
So Frano had the first question. Frano.
Since I cut you off because of timing, can you expand on the new legislation? And I want to applaud you, because you were one of the persons that has stood up to, I almost like to say, to our local dictator in Albany, who's telling everybody what to do, and yet he doesn't follow his own rules.
Yeah.
Can you expand on the new proposals? And is the Senate going to take up impeachment, since it is my understanding that over 1,000 unnecessary deaths took place in nursing homes?
Okay, so let's talk about the legislation first, okay? So for the bills that I didn't talk about, essentially what the purpose of the package is to create more in nursing homes with data, with the Department of Health records. And then one of the bills that I think is probably one of the best ones is the ratings bill, which means that if you are looking for a nursing home for yourself, for a loved one, there will be a rating available. So you can see that information and you will know that this nursing home is not a place you want to send your family members, or it is. It will also incentivize the nursing homes that have lower ratings to do better, which they have to do, ought to do. So that's one. Making sure that there are infection inspection audits so that the Department of Health can establish and make sure that there are checklists that a lot of these nursing homes can follow is another one of these bills, because believe it or not, these protocols do not exist, and that is a problem. Thinking about the standards of ownership for nursing homes. And so this is a bill that will require more review of who owns the nursing homes and to really make sure that there is a certificate of need process followed, including a consideration of things like past violations at other facilities by certain owners. And so that matters because what we see is that certain people may own a nursing home, but you might not be able to see into who that person or owner is. And that is not acceptable because these are the people who are literally taking care of the most vulnerable population. There are so many other bills. I can go through a few more. There's another one for to make sure that there's transparency in the violations that take place, right? And so to make sure that nursing homes disclose in writing to potential residents and their family members on their website where a list of their violations are and what they were, so that people can find them, because it's almost impossible to know what violations existed. So there's a whole bunch of other things. One thing that we didn't do that I think is like quite literally one of the most important things we can do this year is something called the Safe Staffing Act. And what that will do is essentially create ratios depending upon where you are, a ratio of nurse to patient, right? In hospitals, long-term care facilities, assisted living facilities. Why does that matter? Because right now there are some nurses who are taking care of patients, one nurse taking care of 30 patients. I'm not even making it up. One nurse taking care of 50 patients in one nursing home in the district I represent. That is like impossible, especially because some patients and some residents actually require 2 people to lift them, to bathe them. So if there's only 2 nurses on staff for that shift, and there's 50 residents, and that resident needs 2 people, well then those 2 nurses are just taking care of that one person, and all 49 other patients are not getting the care that they need. And it does lead to death. And when we think about this in hospitals, it has been most, I think, abused in hospitals, and nurses are not only overworked and overrun, but they are frankly traumatized by what they've been through. And this is the least that we can do to make sure that that actually happens. So that I think will happen in the budget. To get to the last point, the last like 2 points that are together, I have been very vocal about the lack of transparency in the reporting of nursing home deaths by our executive branch, namely our governor. I am not only disappointed, I am furious. I am furious because the least that we can do is provide transparency. That's the least that we can do, and be accountable. And every one of the 15,000 family members who stands behind a person who died deserves the answers. It is not okay to pretend that the numbers are lower. It's not okay. So there's a lot we can talk about there. What I believe are the most responsible steps: removing his expanded emergency powers, repealing immunity that was slipped into the budget last year at the 11th hour to give immunity to nursing homes so that nobody can sue the nursing homes for any of the lack of care that was given during the pandemic. Going and doing oversight and investigations, the legislature, the attorney general. There are currently 2 federal investigations, one through the FBI and another one through the EDNY, Eastern District of New York. And then regardless of the federal government, but if they have findings before the state, that's fine. But the state needs to do investigations too. And so whatever we find, then if it is an impeachable offense, then we have to do that, because we have to also hold ourselves accountable. And we have to not think about this issue. This is the last thing I'll say about this. This is not a political issue. This is about people's lives, period. So any discussion about that is like, I don't even want to entertain it because it's not relevant. I would hope that everybody would do this no matter what party, what's going on, because it is literally one of the worst crises and scandals, honestly, that I think our state has ever had. So that's all I'll say on that. I could talk a lot on this topic, but I'm very passionate about it because so many people that I know died in nursing homes, and so many residents of District 34 died in nursing homes, and their family had no idea. No idea.
So the questions, Daisy followed by Al, and if anybody else, I think Oral has one. So Daisy, Al, Oral. Daisy?
Yes.
So
Senator.
this is more as a thank you, Senator, for this, as somebody who has gone through the system with my own parents. These nursing homes are quite scandalous, and it's quite scary as we're aging and we're seeing our own mortality. I really hope that these bills can pass through, and if there's anything I can do, please let me know. So thank you.
Thank you, Daisy. I appreciate that. And I'm just looking at the chat at the same time too. Just for those of you who have lost loved ones in nursing homes, I want to just first say that I'm very, very, very sorry for your loss. And there are really awesome advocacy groups coming together. One of them is called Voices for Seniors. It's on Facebook, and there's 4,000 members in it. And it's not just to, I mean, it's a space absolutely to share your story, but also it's a space for advocacy. And so I think that if you are interested in that kind of thing and that calls your name, you should join it, because there's a lot of action that's going to take place, calling on, right, to Daisy's point, like, what can we do? There are bills that we can pass to like really right a lot of the wrongs, and most importantly, allow some of the families who do believe there was wrongdoing to pursue justice in court, because nobody should be precluded from that.
Okay, Al?
Yeah, thank you, Senator, for coming this evening. A question. You're talking about rescinding the executive powers of the governor. Wasn't
The expanded emergency powers.
Right. Wasn't it the Senate and the Assembly that voted to give him those powers?
Yes, it was. It was. Okay. And it absolutely was. Yes, it was. On March 2nd of last year, the Senate and the Assembly voted to give the governor expanded emergency powers. We can talk about the discussion behind the scenes, or the fact that the bill was given to us with about only an hour to decide what the right thing was to do. Many of us, myself included, believed that we really didn't have to give him these powers. Why? Because anytime a governor in all 50 states issues or declares a state of emergency, that governor gets expanded powers already. They don't need more powers. So the way that this was presented to the legislature from the governor was, here's a bill to expand my powers so I can issue directives, which is troubled in its own way, which essentially is like passing laws without the legislature. That's what it is. In addition to coupling it with $40 million in COVID aid. We know $40 million in COVID aid is like $0. But the reason I tell you that is because it was done as like a political knot to basically tie our hands, like, oh, you're not going to vote against the COVID aid, are you? Because that's going to be a really bad story, which is so just wrong in so many ways. If we take away the expanded emergency powers, the governor still has powers under the state of emergency. He can issue executive orders. He can issue certain other orders that he can issue as the expanded powers under a state of emergency. So you're not going to see much change. This is what was proposed to us, and what was done, frankly, was like a centralization and a consolidation of power to essentially create like an authoritarian state. That is what it has felt like. The legislature has basically been circumvented in almost every decision that has been made.
And the other area that I'm concerned about, you mentioned the nursing homes. Now, as you know, I have a mother-in-law who's in a nursing home. She's 104. The only way we can see her is through a glass outside. And
yes.
Now everyone in the nursing home has their vaccines, the aides, the patients. Why is it that we still can't go in and see them? They're isolated also in the nursing home, where they really can't socialize with each other because of fear of COVID. So what's happening now is you're getting more people, especially people that are becoming senile, without that socialization, without that talking to other human beings, they start to lose their cognitive abilities. And this is what I'm concerned about.
No, you're like, Al, you're like all right. Like, we don't always agree on everything, but like, this is something we agree on. And you are like 100% right. Like, mental health decline is on the increase, and it's seniors and it's young people who are not able to go to school. It's the whole gamut. Okay. And we're seeing a rise in suicides actually by really young people. But going back to your question, so the bill, one of the bills that we passed this week, okay, it's called the Compassionate, or it's not called the Compassionate Care Act. I just made that up, but it's essentially, that's what it is, allowing compassionate caregiving visitors, okay? So essentially what it will do is create a standardized like system or program to allow personal care and compassionate care visitors at nursing homes. So like a loved one can come to visit on a regular basis according to like whatever the rules are in this program. So what needs to happen in order for that bill to like go into effect, and then family members can visit their loved ones, because you're right, they are declining because they don't have any stimulation. And it's frankly, it's depressing to sit in your room for a year alone. It's just, I'm feeling it. If I'm feeling depressed and I am like all over out and about, I cannot imagine, okay? So the bill passed the Senate, it needs to pass the Assembly, and then the governor needs to sign it. I will just tell you right now, all of these nursing home bills, the governor's gonna sign them. If they arrive at his desk, he's going to sign them. He's not going to not sign them. It's just like, I cannot even imagine a world where that happens. Why also? Because he also said that he wants to do nursing home reforms because of this whole thing that's blown up. And he's using it as a way to say, well, no, we have to make stronger laws, whatever. It doesn't matter. The point is he'll sign them. So we just need the Assembly to pass them. And I believe the Assembly is taking up bills next week on this issue.
Oral, get something? You're on mute.
Hold on. Can you hear me now?
Yeah.
Yes.
Okay, great. I know you're raising up some issues about nursing home, but nursing homes have been an issue, and the problems in nursing homes has been a systemic problem from years now. I know even when I was younger, I've known friends who've put mothers in nursing home and they don't get the best of care. And because of COVID now, it's really come to light.
Yeah.
Right? So these issues that you're saying have been spoken about before.
Yep.
I'm hearing them, I'm hearing you say it, but I'm really not seeing action. You know, I'm hoping you can do something, but let's see what happens. And you have a lot of policy about going after the owner, knowing the owner. I'm not sure what that does. Maybe it does something, knowing the owner, but I think that the issue should be more about how these nursing homes are run,
Yep.
how we're taking care of our elderly, how these nursing homes are even designed.
Yep.
They're really, really badly designed to me.
Yes.
And I don't know if going after all this other stuff is maybe the politicians can handle that, but as a son or a husband to someone in a nursing home, I want to see something now being done, policies being changed now, right now, about how we're taking care of our elderly, not just about knowing who the owner is, knowing the violations.
That's important.
You know, that's easy stuff. I mean, make the hard changes that need to be done. And that's what I want to hear you talk about more, not
So-
about.
Okay, so I think that, to be honest with you, I think that there's a lot to do with nursing homes. Clearly, it's also one of the reasons why we have so many deaths there. So you are absolutely right. And yes, people have been talking about this issue for a long time. And
a long time.
It's messed up. I was going to say the other word. It's messed up. And I'm just going to tell you something right now. For about a year, there are some of the things that I've been frankly screaming about at a decibel that has made me almost sick. That is only finally just coming to air now. Because there's a lot, like what I just want to share with you on a very transparent way. There's a lot of money in nursing homes. There are a lot of special interests that have it's not in their best interest as a special interest organization or group or whatever it might be to put lights on the nursing home or to allow people to sue nursing homes or to have a rating of what their nursing home is. I think that the bills that I mentioned, which are the ones that are the most important, I think, are issues and also efforts to create more transparency, because part of how this bad behavior persists is that there's an opaqueness to who the heck these people are. What has this nursing home been cited as? And so it allows this behavior to persist for years, and it does lead to death, and it does lead to people being sick and also not being fed. I had a grandmother in a nursing home in upstate New York who couldn't use her hands to eat. And she was an Italian grandma, you can imagine what that is, very healthy. When we went to visit her, she would look like a skeleton because they put the food in front of her, nobody fed her, and then took the food away.
My mother died in a nursing home, so I know what you're saying.
I'm sorry.
And
But
I can see, but maybe.
I hear you. I hear you. I do.
So if we can move on to the other questions, if you don't mind.
Okay. Yeah, go ahead. Go, Jeremy. Sorry.
Can I just make one offer? If anybody wants to talk about these nursing homes and what you think we should do based on your experiences, I would love that. I mean it. I would love that so much because now is the time to do it. I'm telling you, it's now. So if there are additional ideas of things to do, let's do it because there is a desire to do it because a lot of people are in the hot seat right now.
Yeah, hey.
Yes, hi, Senator. Thank you for joining us. Just a quick question. Would you support the impeachment of the governor?
If there is wrongdoing found, yes. And I don't think that that's controversial. And I think it's a problem for anybody who wouldn't if there was wrongdoing found. That's highly problematic. I don't think it's controversial to hold accountable people who break the rules or the laws.
Well, some people obviously get away with it.
A lot of people get away with it.
Yeah. Averill Francis.
Okay. Biaggi, thank you so much for being here. I think you did a show tonight, but thank you for the opportunity that you shared on my program before. And you know you're on your way back.
Yeah.
And this opened up the whole show. But I just want to say that as Orwell says, it's been going on for a long time. I have worked in nursing homes throughout the Bronx, and it's been, when you said about one person taking care of how many patients, we've been screaming and crying out. I literally resigned from my job because of frustration, because I couldn't sit down and watch it happen anymore. I had no one to listen to me at that time. I was screaming and hollering and writing letters. No one was listening to me. And even now, I am still fighting with some nursing homes and asking them, why are we still sitting there complaining but doing nothing about it? So the patient is suffering. So I'm not going to take up much time because you and I have our platform set, but I want to say that Orwell, when you said, why worry about who owns the nursing home? It's important. It's important because I worked for a nursing home in the Concourse for many years. We was underpaid, no insurance, patient was suffering. We fight, we protest, we demonstrate. And in the end, because the owner was not registered in his correct name or there was some kind of names issues, we lost and we had to fight again until the city and state step in. So it's very important who owns this business. They have to be held accountable. Thank you so much, Jeremy.
I put all the bills in the chat, by the way.
Go
Jeremy.
Go ahead. No, go ahead.
No, I put just a little summary of all of the bills that the Senate passed this week into the chat. And then before, when the questions are done, I'll put my email in there too. And I mean it. Like, I really want to hear, like, what should we do? What do you think we should do that hasn't been done yet? Because this is the time. And I do think, to the point that was just made, Avril, like, I do think safe staffing is going to happen. Mainly also because the Attorney General put that in her report too, which is great.
Al, you had a follow-up question? Go ahead.
Another question I'd like to ask. We asked Councilwoman Gibson, and I would ask you the same thing. We have that problem on Stillwell Avenue where the city is getting ripped off. She promised she would look into it. Would you support her efforts and see what's going on in Stillwell Avenue? We could save the city $1 million a year.
Yes, I will work with Vanessa Gibson or Council Member Gibson, on this. Absolutely.
And I believe Natalia's on board, and I know Mark Jonah is on board. So if we get all our elected officials to work on this and find out something's not right there.
Sure.
They're making a fortune on the back of the homeless, and that's not okay.
No, and let me just say one thing about that. It's not okay, especially right now. Well, it's never okay, to be clear, but it's not okay, especially right now, because so many people, especially people in the Bronx, are either on the verge of homelessness or have become homeless. And that's even despite, by the way, us putting moratoriums on rent and also mortgage payments, because we have found out in several instances that the courts are still pursuing eviction cases. So, and that's because of the way that the laws were written or the executive orders were given. So it's not a perfect catch-all protection system. And so the housing, it is a crisis. It's not hyperbolic to say that. It's bad. And so we have to be able to have like the right places caring for the people who are cared for, and people should not be profiting off of that or disadvantaging people because they can make a profit.
So Senator, one thing I would give the governor credit for, don't kill me, anybody, is that the only reason we're able to meet right now is because of the executive order.
Sure, of course. No, Jeremy, listen, in order to be able to criticize, you have to be intellectually honest. There are things that have been done well. It would be a lie to say that there wasn't. Things that have not been done well, namely handling of nursing homes. Both things can be true, and we have to say that. And it's okay to give credit where credit is due. In fact, you should give credit where credit is due.
Yeah, I just want to know if there's a way to make the option for remote meetings permanent.
Good question. We're working on it right now. That's something that I am obsessed with, because it's not only meetings, notaries. There's a bill to do virtual notaries, to be able to record deeds, to be able to renew your license. There's a whole host of things that I think that have become more convenient and will be more convenient once we're out of this, that I think people would really appreciate. So we're working on it.
Senator Biaggi, real quick, this is Darrell Bowen. You think I found out virtual notaries, so you think that will be permanent?
I do. Nice. Yeah. Just more convenient for everybody. It's very hard to find a notary, and there's just some things that
I'm a notary, so I asked that question because a lot of people try to get my help because I work for an institution. But yeah, so I was just curious about that. Somebody brought it to my attention that we are actively doing that. I didn't even know it. So
yes.
That's good.
Yes, we are. Yeah, it is. I think it is too.
I had a question. This is Chris.
Hi, Chris.
Hi, Senator. I mean, since you're talking about all these things being done virtually, what has been done about avoiding hacking? Because hackers, they don't believe on that.
Yeah, that's a great question.
You're gonna do everything remotely. I won't be surprised that one day somebody's gonna show up in my house and say, "Listen, this is my house now. You gotta get out." Because with all that hacking, everything is expected.
Okay, so good question about hacking. So there's a proposal in the budget to deal with data collection, data privacy. So there are bills underway, but we are not at the level that a California is. California legislature has done, I think, a really bang up job when it comes to data privacy as well as prevention for hacking. In fact, last year, New York State records, I think it was the Department of Education, but if I am wrong, please don't hold me to that. I believe that they were hacked. There was one very big agency hacked, and then we didn't hear about it. What happened? What's going on? So there is a real need not only to increase the data privacy, but also to update our systems. A lot of our systems, including our computers, are very old, and it does make it easier to hack. So I hear you. And there's some things being done, but not all the things that are being done or need to be done, I should say.
Okay. And
hello, I have one more question. It's Joanne Terrell.
Go ahead, Joe.
Good evening, Senator Biaggi. With all the changes that are happening, what are we going to do with the educational system for the kids that are lacking? They don't have the proper equipment, computers. What are they proposing for the educational system?
That's a great.
We're talking about everything.
Yep.
What this new generation?
Totally. So there is the biggest digital divide is in the Bronx, and also with the exception of obviously upstate New York, where the rural areas mean that broadband doesn't even exist. So that's a different. It's not even. I can't even imagine what that is like. But we have the ability to have broadband. But what we're working on, number one, is making sure that all of our schools and all of our homeless shelters, because bear with me for a second, have Wi-Fi and have proper Wi-Fi. Why? Because there are children also who are in homeless shelters who are doing remote learning, believe it or not, and it is basically impossible for them to deal with this. So I have a bill actually to bring Wi-Fi into homeless shelters for children to be able to learn, and for other reasons, because what we're also seeing is that any survivors of domestic violence who are not in a DV shelter but are in a regular homeless shelter are not able to access or communicate with their lawyers. And that's because there is no Wi-Fi or computers in there. And that is obviously very problematic because it keeps them stuck in a very dangerous situation. Okay, so that's number one. There is funding in the budget, or at least from our side, meaning the Senate side, that we are allocating towards making sure that we bridge the digital divide from devices to Wi-Fi and et cetera. But then there's also something that needs to happen, which I think it will happen, but how fast it will happen, I don't know. The effort to have broadband across the whole state, from the city all the way to up in the rural places, is a part of this. But in addition to that, making sure that all of the students at least have a device and the schools have devices to be able to lend out is something that not only the Department of Education in the city has committed to, but the state is committed to in terms of funding. So we know that there's a budget shortfall. Like, I could talk to you all about that all day and what we should do about it. But I agree with you, Joanne, and also just know that myself, Assemblymember Hevesy from Queens, and Senator Mayer, who is the chair of education, is literally working on this proposal. Senator Mayer's proposal is more robust and more likely to pass, but it is meant to bridge that divide, because I agree, there are children literally learning and doing remote learning on their parents' cell phones. Like, that is insanity.
Unaccountable.
Insanity. Yeah, and just for everyone's awareness and full transparency here, I have made, and Emily is here somewhere in one of these boxes on one of these screens, and Emily's made a lot of these requests for me. I have made countless requests to speak to the chancellor about where on their list does certain zip codes in District 34 fall for tablets and for computers. Not only did they refuse to share that information, they refused to have the meeting. That lack of transparency as well. This is at the end of the day, if
accountability.
Yeah, it's there's no accountability without transparency. There just isn't, because then what am I supposed to do? Break into the office? I can't. Where am I supposed to get that information from? It's completely outrageous that another government official would not just respond. And it's not just me. It's me. It's John Liu. There's others who are not getting responses, and it makes it very hard to do exactly what you're saying. So it doesn't mean I don't ask, and it doesn't mean I just stop there and say oh, I give up. There's other ways to deal with it, but just for your awareness, that is our experience, and it's just not right. It just doesn't work.
Okay, thank you.
You're welcome.
So I didn't see any more questions, so we can move on maybe.
One thing. Senator, can you put your email on chat?
Yep,
please.
I'm going
Thank
to.
you.
Okay, all right. So
thank you.
Be back.
Thank you very much, Senator.
Thank you, Jeremy. I appreciate it.
Have a good night.
Here.
I'm just trying to pull the agenda. Ethics Committee, John Johnson.
Yep, thanks, Jeremy. So the Ethics Committee met on February 16th. You guys can all hear me, right? I guess so. Hope so.
Yes.
Met on February 16th. We discussed a couple of topics. The complaint form. I believe there's one on the website now, and we're modifying some of it because it's been kicking back and forth in different arenas. So hopefully we'll have that up, right, Jeremy?
Yep. We got those additions, so we got to talk about that.
All right, and for the flow procedure, as we're going more and more into the flow procedure, we want to make sure we put out something that's comprehensive and correct. So every time we have something, there's some questions about it, so it kicks back. So one of the things that we want to do is we don't want to publish anything that's going to be, which is wrong, and I'm sure it'll be criticized. So we want to make sure we want to put the best product out before we put it out. So we'll still working on that. The other matter that we discussed was Curvins, the bar, and we issued a statement on it, and it holds the position of the community board on that matter. I think it was emailed out to everybody. So that's it.
Okay, Housing Committee, Hazel.
We did have a, hi, everybody. We did have a meeting and my minutes were submitted and hopefully distributed.
Yeah, they were.
Thank you.
Thank you, Hazel. Housing, or leadership, Yahe, we didn't go to your committee. I don't know if you wanted to talk at all. Did send out your minutes.
Yeah, I just wanted to piggyback on what Al was saying. We all do something very important. It's community service. But remember, there's only one worse thing. Maybe there's one worse thing other than not having a quorum and only having one person at the committee meeting, and that's no one taking minutes and not having a record of the meeting. So honestly, I'd probably prefer that a meeting was not held because there was no quorum than to have a meeting with a quorum and not have minutes. I've mentioned it during the leadership meeting that the chairpersons should ask someone to volunteer to take minutes. And now I'm just going to mention it and bring it up here so everybody's aware. The chairperson might assign someone from that committee to take minutes. It shouldn't be the chairperson all the time. So we need to share the work. The chairperson is busy. They're running the meeting. Someone should assist them. And I encourage, again, all the chairs at the beginning of every meeting, ask for someone to be the secretary for that meeting and rotate it amongst everybody. It'll help you out. We'll stay on point, and we need to have the minutes. It's very, very important. Thank you, everyone.
And
Not
then
secretary, minute taker.
What's that?
Oh, I'm saying it's not called a secretary. It's called someone just to take the meeting minutes.
Yeah, I mean, it's up to each committee how you want to do it. But speaking of minutes, Hazel, do you want to make a motion about the full board minutes that were sent out previously? I think on Saturday. Oh, God. Hazel?
Yeah. So I'd like to make a motion to approve the January 2021 full board meetings as they were distributed.
You second that?
I second that.
I'll second.
Bernadette?
Yes.
Anybody? Any discussion? Any against or abstentions? Hazel, that's unanimous.
I'm sorry, what?
If nobody's abstaining or objecting, then it's unanimous.
Yes. So the motion's approved. Thank you.
Thank you, Hazel. So going on to the rest.
Jeremy, may I ask a question before we move on about
Sure.
the minutes?
Sure.
Are we not using the tape recorder anymore to take the minutes?
There's no point of. Can you mute your? Can you mute your mic? So there's no. I gotta mute everybody. Can everybody hear me now? Fine. Okay, so there's no point of a tape recorder like we used to have a physical one since we're not physically meeting. Yeah, I mean, I am recording the meeting tonight. So, any other questions? So moving on, and this is being live streamed, by the way, on Facebook. Because I can do that with WebEx, not Office Suite. Housing committee, we did public safety. Veronica.
We did have our meeting this month. The minutes have been distributed to the board and will be published on our website as soon as we can. I do want to mention that for next month's meeting, we're going to have the Con Ed customer outreach, who's going to be doing a gas leak 101 presentation for anyone who wants to join. This is as what happened, as everybody knows, from the Paulding Avenue gas leak explosion. This is in response to that. So anybody who would like to come to the meeting and hear it, that'd be appreciated. Thank you.
Thank you, Veronica. and Frano had to leave. So Joe Menta is going to be timekeeping
I'm
for the
still
gallery.
here, Jeremy. I'm still here for more minutes.
Okay, Frano. Transportation.
Okay, transportation met and the minutes have been distributed, hopefully by the board, but we did meet.
Okay. And then that ends the committee reports, unless I'm missing anybody or anything.
Good night, all.
Thank you, Frano. So I guess now Frano's exiting. Gallery session.
Jeremy, do you you didn't mention parks, but I know Sister Charles is not here, but we did meet. The minutes were taken and they've been submitted. And then just to echo what Yahe said, we voted on having like a roving secretary or recorder to take the minutes.
Yeah. You guys met in January, so that's why. Yeah. Now
Got
that I got a chance to see the minutes yet. We did get them today, so we will distribute them as soon as possible.
Okay. Thank you.
So
Yeah, I don't know. I don't know if did you mention land use? I don't think we met, right?
no, you did not meet.
Kenny? Okay.
Unless there's something to announce, I'll move on to the gallery session.
Okay.
So I don't know if Mr. Press is here. He was the first to sign up.
Yes,
Mr.
I am.
Bob Press.
Yes.
Okay.
I
Two
put
minutes.
in, Jeremy, can you check with Councilwoman Gibson? I don't know if she's still here. That I put in the chat 25% of the homeless population for a community board should only be adult single males, as opposed to what Community Board 11 will be getting, over 50% of a homeless population of adult single males. So can you check with her on that, please?
Okay.
Secondly, the board needs to watch out for overdevelopment that has gone on in other community boards. It will be coming to Community Board 11. Lastly, on Leidig Avenue is a bar where there never was one years ago. In 2019, the owner wanted to increase the hours from 2 a.m. to 4 a.m., even though 4 a.m. is the mandatory closing time by the State Liquor Authority. Community Board 11 voted against it, and the owner abided by the board's decision. Recently, though, this bar has come under fire again for a street dining enclosure, which is allowed by the mayor's street dining program. Unfortunately, words have been exchanged to the feeling of discrimination by the owner, and the SLA laws and mayor's street dining program says the owner, Ms. Davis, is in the right. Curvins has the right to put that structure up, and as a resident of CB11 who has been in Curvins more than once, I fully support Ms. Davis, the owner of Curvins, and CB11 must accept Curvins as a CB11 business and treat it no different from any other business in Community Board 11. Thank you.
Okay. Thank you, Bob. Unless there's any questions or comments, we'll move on. The next gallery session speaker had to leave at 8 o'clock, so he will not be joining us. That was the alternate library manager, Manny Martinez. Unless he's still in by chance, I doubt it. Charlene Jackson Mendez was the next to sign up. Charlene?
Can everyone hear me?
Yep.
Okay, I wanted to say good evening to the members of the community and to thank Board 11 for all of the work they do on behalf of all of us. Special thanks to Bernadette, Purdom, Joanne, and Yahe, who represent Van Nest. I just want to say a couple of things very quickly because it is Black History Month, and as a Black American, I wanted to acknowledge my family members who have sacrificed so much, including getting through slavery, the Jim Crow South. I have 4 uncles that served in World War II and an aunt that served in that capacity. My father, who was a drill instructor for 7 years during the Korean War, and my brother, who did a tour in the Marine Corps. I wanted to mention them because I feel like they represent many Black Americans, and I'm just deeply saddened by what is going on at the city, state, and federal level. They work so hard to give me an opportunity to be a free person. And I see so much legislation being passed so quickly that has a profound impact on our community, and we can't even digest what is happening. A lot of times these things are done under the guise of helping Black and brown people, but they're hurting us. I've heard a lot of
30 seconds, please.
Yes, in particular, I'll just mention the bail reform law, which all of our Bronx state senators, I believe, signed on to. Since that time, there's been a 45% increase in the murder rate in New York City. And as you know, whenever crime goes up, it hurts the Black community especially. So I'm doing what I can by now deciding to come to these meetings. It's very difficult via Zoom to sit here nearly 3 hours. I can't wait till we go back in person. Please make sure that Van Nest, the Van Alliance, is aware of any proposal for our community.
Thank you very much, Charlene. So, unless there's questions or comments, we have Diana Finch, a CB11 resident.
Hi, everyone. I'm here to speak on behalf of Bronx Park East Community Association about a matter of concern about our parks. I learned the other month from the Parks Department that all capital projects for which construction had not begun before the pandemic shutdown are on an indefinite hold, even though the money's been allotted for these projects and construction in New York City is no longer halted. And the reason apparently is that the mayor is so concerned about cash flow in the city budget in the absence of any pandemic relief from the federal government that he doesn't want the city to run out of cash for essential services. So he's putting a hold on all the capital projects in the parks, which he feels are not essential. And this means that the only repairs that are being done in parks are when there's a dangerous condition. The biggest project on hold in CB11 is the Waring Playground and Basketball Court, where construction has now been delayed for 18 months. The playground surface is dangerously worn, but it's too expensive and extensive a repair to do on its own when there's a larger repair planned. So I'm just asking everyone that we do everything we can to push for passage of the new stimulus bill and prompt action by the city when that bill does pass. Thanks.
Thank you, Ms. And then last but not least, we have Roxanne Delgado, CB11 resident.
Yes, hi. I was going to discuss something else, but since Stillwell was brought up, I'd like to just state, as a person who organized several campaigns in this district and outside this district, in order to have a fair chance of winning your campaign or your advocacy is to provide information, not misinformation. Regarding Stillwell Avenue, it was not bought overpriced because just a property just half a block away was bought for over $5 million. It's the same size, square footage, and zoning. So it was not bought over market value. It was bought within the market value. 1682 was bought for $4.8 million, and 1538 was bought for over $5.1 million. Second, regarding the rent is $3 million, that's not correct. The rent includes the purchasing of the land and building the 6-story facility. Now, I have to agree there is some issue with the permit, but I don't have the time or the expertise, but hopefully our electeds will look into that issue with the Department of Building. Something's not right, but I don't know what it is. Second, as regarding the vaccination misinformation, thankfully the mayor's office gave us over 500 information sheets on the facts on vaccination, which will be given out this weekend. So anyone who wants to help out, by all means, ask the community board to reach out to the mayor's office to get that information sheet and give out to your local community residents, because it's our duty to help out our neighbors. You know, we are going through such a hard time. In order for us to succeed, our neighbors have to succeed with this pandemic. We're all in it together, whether we like it or not. We don't have to like each other, but we could at least provide people the information.
30 seconds, please.
And lastly, I think I heard community board members say that they can't get into meetings because they don't get the information. I'm correct. They're right. We need an email sent regularly to all the members of the public and community board members on the details on how to join meetings, because there seems to be a lapse in that information provided by the community board staff. Thank you so much. That's it.
Thank you.
Thank you. So that ends the gallery, and then we go to the elected official reps. So if we heard from assembly members and the electeds themselves. So is the borough president's office here?
Yes, Jeremy, I'm here.
Go ahead, Tom.
Hi. Good evening, everyone. As we reach 9:45, I'm going to be brief. Most of the information that many of the electeds shared this evening goes for the work that our office has been doing. All of that information is on our website, all with updated information on vaccination sites, COVID testing sites, etc. So please feel free to go to that site. We've also shared with all of you our latest newsletter, which also includes that information that you can share with all of your organizations. Reappointment applications were due on the 5th of February. I am still collecting some that were sent through the mail. Our office mail has been relatively slow, so I am still collecting reappointment applications. You should all have received your email from DCAS regarding the sexual harassment training course that you are required to take. The email was sent directly from DCAS, so please take a look. If you don't think you received it, it's an email that you probably are not familiar with. Please look in your junk mail. If you did not receive it, please let me know and I will have them resend it to you. So if you have that to me before Friday, I'll send a list to DCAS on Monday. Somebody did mention earlier about computers and laptops. The borough president's office has given laptops and Chromebooks out through a private philanthropist who's donated funds for us to purchase Chromebooks on our website. If you go to the youth portion of the website, there is a link there that you can fill out a form to possibly get a Chromebook if your child needs one and it is not being provided by the school that he or she goes to. They are limited. We had 2 giveaways that were organized through each of the schools that our office was in contact with. So please take a look at that. And if you have any questions, you can always reach out to me. Thank you all and have a good evening.
Okay, great. Thank you very much, Tom. So then we have Councilmember Jonai's office. Amir?
Yep, can you hear me?
Yes.
All right. This is Ardmir Malzio from Councilmember Mark Jonai's office. Just a few announcements. Councilman Jonai is providing weekly food distributions and rapid COVID-19 testing events throughout the area. We have testing events coming up in March. You will get your test results while you wait, so stay tuned on social media for dates and locations. If you don't have social media, you can sign up for our weekly e-newsletter. Every Tuesday, those in need of food can come to pick up a food box from 2 p.m. to 5 p.m. on the corner of Astor Ave and Boston Road. Our office is also providing one-on-one free tax prep services to those who qualified with an income limit of $68,000. While our office is still closed, we will host these at the Morris Park Community Association located at 1824 Bronx Hill Avenue. Please call our office for an appointment. We also offer free virtual immigration services with CUNY Citizenship Now, free housing assistance with NIDC, free legal services with NILAG, social and senior services with BJCC, and much more. If you are eligible and need a vaccine, having difficulty receiving one, please contact our office and we will work with Jacobi Hospital to try and schedule an appointment for you. Lastly, if you have any questions, please reach out to our office at 718-931-1721 and also check our social media for future events and happenings in the district. We are physically closed, but you can contact us Monday through Friday from 9 a.m. to 5 p.m. That's all I have. Thank you.
Thank you.
Thank you. I don't know if anybody from Councilmember Riley's office is here. That is the new council member has taken over for Andy King's position. I'm just going to read off the list. And if you're here, Mayor's office, Public Advocate's office, Bronx District Attorney's office. I believe I saw Christina.
Hello, Community Board 11.
Yep. Christina. Can hear you.
Can you hear me?
Yes, yes.
Hello?
We can hear you. Go ahead.
Can you hear me? Okay, I apologize. I'm sorry. I'm in the middle of trying to put my kids to bed. Hi, Community Board 11. On behalf of District Attorney Clark, happy Black History Month. Just general announcements. Thank you for inviting us to your public safety meeting. We are open. We are working remotely as well. If you know of any, Poppy, hold on. If you know of any victim of crime who is looking for services or resources, have them contact our Crime Victims Assistance Unit at 718-590-2115. If you know of anyone who needs help, a constituent with something related to crime, have them contact our Community Affairs Unit at 718-590-2272. And I'll drop all my information in the chat. I shared it earlier, but if you didn't see it, I'll reshare it in a bit. Thank you, CB11.
Thank you.
Is my video showing?
No, definitely not. Don't worry about it. Destiny Cruz?
Yes, I'm here. Hi, folks. Happy Black History Month. I will shorten my remarks. Just wanted to let you all know the Congresswoman did have her monthly town hall on Tuesday, February 9th regarding the vaccine. If you want to see, if you would like to see the town hall, you can go onto our YouTube channel at Rep AOC. There's a ton of information on where you need to go to get vaccines and other information that we have from the state and the city. You also can sign up to our newsletter. I will drop those links in the chat. As for a legislative update, just so you all know, the Congresswoman in January, along with Representative Bowman, led 52 House members on a letter asking HUD and the Treasury to repeal the Trump-era guidelines, which are delaying emergency rental assistance by requiring overburdensome documentation. The Congresswoman has also spearheaded the FEMA funeral assistance with Senator Chuck Schumer. This is now official. You can apply for up to $7,000 in relief if you have laid a relative to rest to COVID. You can apply to get up to $7,000 reimbursed for that. FEMA is the one who is creating the application. The application itself is not yet live, but the moment that it is, I will be sharing it with Jeremy and with the leadership of Community Board 11 so that everyone—
30 seconds, please.
You got it. So everyone here can apply for that. We are looking for a Wounded Warrior Fellow. This is a fellowship program for a veteran. They will hold a 2-year period job with our team. We'll get paid $52,000 a year with benefits. I will share the link there. If you know of a veteran who might be eligible, please send them our way. As I mentioned, the art competition, we are getting the ball rolling there. And then I also just want to spend some time on this.
That's time, Destiny.
Can I just mention this? It's a minority business development grant. I will share the details in the chat.
So somebody want a question for Destiny and let her continue?
Yeah, what's the issue with the grant? Can you elaborate?
Absolutely. So the Minority Business Development Agency has notified our team of a 5-year term grant opportunity available to for-profit entities, non-for-profit entities, institutions of higher education, and much more. The grant is designed to support innovative projects that promote and seek to resolve the challenges faced by minority enterprises. Each proposed project should align, complement, and support the agency's mission to promote the growth and global competitiveness of America's minority business enterprise community. There is a deadline to submit an application for this grant. I will send the link in the chat. There will also be a pre-application conference call on March 1st, 2021 from 2 p.m. to 3 p.m. We'll also send the registration link in the chat. Would love for as many of our constituents who are eligible to apply to please apply. I know many of you have your own businesses, and we certainly want to support our community as much as we can, and we can do that with these grants. So like I said, I'll send that all in the chat. As you know, we are receiving federal casework, and I will leave my information there so you folks can contact me anytime. Thank you.
Thank you. We already heard from Biagi's office, so we'll move on to Senator Bailey's office. If Ronell or anybody else is in. If not,
hi, this is Ronell from Senator Bailey's office. So Senator Bailey, along with several elected officials, have been giving out food in the community and PPE, such as Assemblywoman Natalia Fernandez, Speaker Carl Hasty, and newly elected council member Kevin Riley. Also, as mentioned by Darrell Bohan, he had asked about having more information regarding the COVID-19 vaccine. So our office is doing a vaccine info series. If anyone is interested, please email me. I will provide my email in the chat. So that series is from March 1st to the 5th, and it's usually between 6 to 7 or 7 to 8. So if you would like more information regarding the COVID-19 vaccine, because many people are skeptical about the vaccine, I highly advise you to join our series. And if you are interested, please email me. Thank you.
Thank you, Renell. That was great information.
Thank you.
Thank you for staying so long, too. Senator Rivera's office, Caitlin, are you in?
Yeah, I'm here. Hi, everyone. This is Caitlin from Senator Rivera's office. I hope you're all doing well. I wanted to give some quick updates from the senator. I know it's pretty late. Many of the bills that Senator Biaggi mentioned regarding nursing home reform are actually sponsored by Senator Rivera. We are incredibly happy to have her support. We are so proud that these passed the Senate. We are looking forward to the Assembly discussing these bills soon. And as Senator Biaggi said, we are hoping that the governor will sign them. The senator also hosted a vaccine town hall earlier this month. We were joined by several public health doctors as well as local providers. There's a lot of information about how these vaccines work, the history of the vaccines, and all of that's available. The whole video is available on our Facebook page. I'll put my information in the chat, so if anybody has questions, you can reach out to me.
Okay, thank you. And I don't think we have anybody from Assemblymember Heasty's or Benedetta's office. And unless there's any other elected that was hiding, we'll move on to old business. Anybody? Or new business? Or motion to adjourn? I see mouse moving, but I don't hear anything.
I put motion to adjourn.
Motion to adjourn. Sorry, I had to unmute. I had to unmute, Jeremy.
I second that.
Anybody, seconded. Anybody against or abstaining?
Are you for real, Jeremy?
Yes.
Is that up for discussion? Okay, meetings over.
Discussion. You
Are
gotta
you just
be
seeing if
kidding
we're
me.
awake?
I know you love us, but it's time.
No. I got to go myself, right? 9:49 p.m. Meeting is over, right?
It's 9:50. Yes, Jeremy. Thank you.
Yep. All right. Ciao.
Everybody.
Ciao,
Take care,
ciao,
everybody.
everyone. Ciao, everyone. Good to see you, Joe. Joe Thompson. Good to see you, my man.
Good night, guys. Stay safe.
All right.
Vote it.